The committee will come to order. The Oversight and Government Reform Committee exists to secure two fundamental principles. First, Americans have a right to know that the money government takes involuntarily from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to, in fact, protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know that the money government takes from them is well spent. It is our job to work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. 3.5 years ago, closer to 4, in a partisan vote, the House of Representatives passed the Patient Protection Affordable Care Act, commonly referred to as ObamaCare. The Act gave this administration more than 3 years to implement. It gave them virtually unlimited money. It ensured them that for all practical purposes they need not come back to Congress ever again, because they created an entitlement, one that raised its own money, spent its own money, created its own rules. The 2,400 pages that were passed into law and then read afterwards now represent tens of thousands of pages of regulations that were created by this administration based on how this administration wanted a law interpreted, meaning that legislation created 3.5 years ago was still being written in late September. The cornerstone of the President's signature achievement included a website, HealthCare.gov. This site and parallel sites created by some states were supposed to make it easy to have an online marketplace. It was, in fact, an attempt to duplicate what hundreds, perhaps thousands, of insurance companies, large and small, around America do well every day. On October 1st, President Obama said using it would be as easy as buying an airline ticket on kayak.com or buying a television on Amazon. This is an insult to Amazon and Kayak. On the day of the launch, President Obama should have known the harsh lesson we have all learned since that time, and that was they weren't ready. They weren't close to ready. This wasn't a small mistake. This wasn't a scaling mistake. This was a monumental mistake to go live and effectively explode on the launch pad. For American people, Obamacare is no longer an abstraction, and it is a lot more than a website. For millions of Americans, it's about losing insurance the President promised you can keep, period. For many Americans, it's about premiums going up when you were promised they would go down by $2,500. Big businesses lobbied and received an Obamacare waiver this year. However, the individual, the taxpayer, the citizen, the only real recipient of health care, did not. Individuals still have to pay a penalty if they don't have insurance that meets a Federal standard, a standard of what your government, your nanny state, believes, in fact, you must have. The penalty is still in effect, and even if new exchanges don't function. The penalty is, in effect, even if you planned on keeping the health care you wanted, period, and discovered it is now gone, or have yet to discover, because ultimately, if you're on an employer plan, you may not yet have found out that your employer either cannot afford or cannot receive the health care you've grown accustomed to. The specific reason we're here today is a narrow part of this committee's oversight and legislative authority. It's, in fact, to examine the failures of what should have been an IT success story. Nearly $600 million, 3.5 years, is larger than Kayak ever dreamed of having to set up their websites. It's larger than eBay spent in the first many years of a much more complex site that auctions in real time millions and millions of products a year. We're here to examine a failure of technology, not because the technology was so new and innovative, not because this was a moonshot, not because we needed Lockheed Martin and Rockwell to come in and invent some new way to propel a ship to the moon, but because we have discovered, and will undoubtedly continue to discover, that efforts were taken to cut corners to meet political deadlines at the end, that for political reasons rules were not created in a timely fashion, that in fact the rules that should have been created at the time of the passage of the law or shortly thereafter, in many cases were still being given to programmers in September of this year. Now, I recognize that there are divisions on this committee, as there were when Obamacare became law. Many members, including myself, believe that there was and is a health care crisis in America. It's a crisis of affordability, and insurance is simply a way to score what that affordability is, not to drive down the cost. Many members, including myself, opposed this new law because we thought it wouldn't work and it had no systems to actually reduce the cost of health care from the provider. My friends on the other side may correctly note, as I will here, that many Americans are benefiting from Obamacare. At the cost of trillions of dollars over a 10-year period, I certainly hope so. But divisions over whether or not taxpayer money taken and pushed back out to needy who are trying to afford health care is not the subject today. Unfortunately, during the first 2 years of the Obamacare law under Speaker Pelosi, there was no effective oversight. Oversight was shut down during the first 2 years of the Obama administration, and the minority pointing out anything was ignored. Under my chairman, we have tried to correct that, but we have been disappointed by continued obstruction by the minority on this committee, defending the administration even when it has failed to deliver the relevant documents and they find themselves objecting to hearings, witness requests, and constantly engage in petty downplaying of what in fact are a serious problem. The minority today will undoubtedly point out that this must be political, that we are not here because only 1,100 people at a time could get onto a website before it crashed effectively, when 250,000 needed to get on it because it was a law and they were mandated. We are not here for that reason, the minority will say. We are here because this is political. This committee, on a bipartisan basis, has offered legislation that if the Senate had taken it up and the President has supported and signed it, and it had been implemented in this project, undoubtedly many of the mistakes made we would find would not be made. In fact, the lack of budget authority for a single point on a project of this sort, conducted and overseen by somebody who had a success story in similar operations, rising to the level of a $600 million multi-committee, multi-state website, if that person had been there and in charge, I have no doubt that person would not be with us today because that site would be up and running. On October 10th, I joined with Senator Lamar Alexander, a member of the minority in the Senate who finds himself unable to get answers, asking Secretary Sebelius to provide documents related to HealthCare.gov. Unfortunately, on October 28, a month into Obamacare, I was forced to issue a subpoena because of a lack of response from the administration. To date, HHS has not produced a single responsive document to this committee. In contrast, the committee has received far more cooperation, transparency, and document production, receiving over 100,000 relevant documents from the private sector, from contractors working on this project, the very contractors who were blamed on day one as their fault, not a single political appointee's fault, not Obama's fault. I know the ranking member and I could fill an entire hearing with discussions about our differences, and I have no doubt, in short order, he will air many of them. But for this hearing, I think we can find agreement. The agreement would be simple. Whether you like Obamacare or not, taxpayer dollars were wasted, precious time was wasted, the American people's promise of Obamacare, in fact, does not exist today in a meaningful way because best practices, established best practices of our government were not used in this case. Now, our government must quickly grasp the lessons of what happened here in ObamaCare's HealthCare.gov project to better and more effectively implement underlying policy changes so this won't happen again. The investigations of this committee have received testimony and have paid documents indicating many problems that led to the disastrous failure to launch on October 1st. The committee has learned that numerous missed deadlines and ignoring of integrated security testing requirements are still a problem for this system. The ranking member gave to me, and I will put it in the record, a letter very concerned that some of the documents we received from contractors, if they got in public hands, would be a roadmap to the security flaws that exist in Obamacare's website today. It is our committee's decision that those documents will not be released, that we will carefully ensure that any material given to us by anyone that would help hackers discover more quickly the flaws in Obamacare's website are not made public. But let us understand, the ranking member's statement in that letter says more than I could say, and that is, on the day of the launch, and even today, there are material failures in the security of the Obamacare website, meaning that even though we may not put out the roadmap, hackers, if they can get on a website that only accommodates 1,100 people at a time, hackers, in fact, may have already or may soon find those vulnerabilities. They may soon find your Social Security number or your sensitive information because there was no integrated security testing before the launch. And MITRE Corporation and others pointed this out in time for the launch to not have occurred until security concerns were properly vetted. The last known security test conducted by the records we've been given, and again, given by contractors because the Administration has failed to be in any way honest or transparent in producing documents, show that in mid-September, at least as to the Federal Marketplace segment of the site, they identified significant findings of risk. Documents from the contractor MITRE identified a chaotic testing environment. According to Mr. Henry Chow, the top operational officer for the Marketplace Administration, delays in issuing regulations created a compressed time frame for building the IT infrastructure. We know, for example, that HHS did not issue any regulations in the 3 months prior to November 2012 election. Yes, I am saying that it seems sad that you pass a law in the first few months of an administration, and yet it seems that regulations came to a halt so they would not be out there in the marketplace during the President's re-elect. 2 years is too long after a law that has mandates before you go and tell the American people and the website producers what they must do. This committee has learned that a complete integrated security testing did not occur, meaning Test the pieces, but do not test the entire product, was one of the faults at the launch. That heightens the risk of unauthorized access, non-encrypted data, identity theft, and the loss of personal identifiable information. This is not this committee's opinion. This is testimony. The Director of CMS stated he was not even aware of some testing results that showed serious security problems in the weeks before the October 1st launch. He testified that these results should have been shared with him and said the situation was disturbing. HHS offered no further explanation for nearly 2 weeks until after the committee made a redacted version of the key memo public. At a briefing last week, Tony Treckel, CMS Chief Information Officer, told investigators he normally signs the authority to operate memos to launch CMS IT projects. In this case, however, and wisely, he determined that he would not sign the HealthCare.gov document, and in fact required a less qualified and obviously erroneous signature by Marilyn Tavner to occur on that document. Now, that's kicking it upstairs because you know it isn't any good. And although I appreciate a CIO not signing a document for a site that wasn't ready, I think at the same time we must recognize that there should have been public objection to Marilyn Tavner signing that document for a website that clearly was not ready for prime time. Additionally, today, we are hearing from a distinguished panel of witnesses, and I recognize that some of the witnesses, particularly Mr. Park, are busy elsewhere trying to get this site operational. But since we have been in the neighborhood of 6 weeks since the launch, I trust that hundreds, or if necessary, thousands of the right people have most of their marching orders, and that in fact it is time for Congress, on any committee of jurisdiction, to look over the shoulder of the Administration to ask both what went wrong, and today, not just ask, do you promise on November 30th to make it right, but will you in fact commit to the changes in law that would ensure this doesn't happen again? I don't hold this committee hearing today to sell IT reform. This committee has already done its job to sell IT reform. However, it is essential that you understand that when Mr. Cummings and I make public billions of dollars worth of failed IT programs, the American people often get a small snippet in the newspaper. So today, I think the American people should know this isn't the $600 million unique event. If it were, it would be a different hearing. This is part of a pattern that occurs due to failure to adhere to the private sector's world-class standards for web production. This is a pattern that includes Schedule C political appointees being more involved than career professionals. This is a pattern that has to stop. Our witnesses today, among our witnesses today, will be Mr. Dave Power, a Government Accountability Officer and an expert in fact, what those practices should have been and what failed on HealthCare.gov. I might note for all, he is in fact a career professional, a nonpartisan, and an individual who doesn't work for me, doesn't work for the ranking member, but works for the American people. I will do the rest of my introduction when the time comes. I now will yield to the ranking member.
Thank you very much, Mr. Chairman, and good morning to everyone, and welcome to our witnesses who are here with us today. I want you to know that I appreciate your service, and on behalf of a grateful Congress, we thank you. And I thank you for your dedication to ensuring that millions of Americans who do not have health insurance will be able to obtain quality, affordable coverage going forward. This is an incredibly admirable goal, and I thank you for everything you are doing to make it a reality. Unfortunately, not everyone in this room shares this very important goal. Republicans opposed the Affordable Care Act in 2009 and voted against providing health insurance to millions of Americans. Over the past 3 years, they have voted more than 40 times to repeal parts or all of the law and eliminate health insurance for people across the country. Since they failed at these repeal efforts, they blocked requests for full funding to implement the law. This forced Federal agencies to divert limited funds from other areas. Republican governors refused to set up State exchanges, forcing the Federal government to bear more of the workload. And to make a political point against the Affordable Care Act, Republican governors refused Federal funds to expand their Medicaid programs to provide medical care for the poor, increasing the burden on their own State hospitals. To me, this is one of the most inexplicable actions I have ever witnessed from elected representatives against their own people, the people who elect them, their neighbors, their family members, their friends, the grocer, the mortician. After all of these efforts, House Republicans shut down the entire Federal government for 3 weeks in October. 3 weeks. Shut down the government. They threatened to default on our national debts unless we repealed the Affordable Care Act. Again, this effort failed. Now they are attempting to use the congressional oversight process to scare Americans away from the website by once again making unsupported assertions about the risks to their personal medical information. Let me be clear. The Centers for Medicare and Medicaid Services and its contractors failed to fully deliver what they were supposed to deliver. And congressional oversight of those failures is absolutely warranted. But nobody in this room, nobody in this country believes that Republicans want to fix the website. For the past 3 years, the #1 priority of congressional Republicans has been to bring down this law. And that goal, ladies and gentlemen, has not changed. Today, they complain that their constituents are waiting too long on HealthCare.gov to sign up for insurance. But is there a solution to fix the website? No. It's to repeal the Affordable Care Act and eliminate health insurance for millions of Americans. While repealing the Affordable Care Act indeed would reduce waiting times on the website, it would increase waiting times in our nation's emergency rooms. Mr. Chairman, over the past month, instead of working in a bipartisan manner to improve the website, you have politicized this issue by repeatedly making unfounded allegations. In my opinion, these statements have impaired the committee's credibility. For example, on October 27th, you went on national television and accused the White House of ordering CMS to disable the so-called, quote, anonymous shopper function in September for political reasons to avoid, quote, sticker shock. That allegation is totally wrong. We have now reviewed documents and interviewed the CMS officials who made that decision. And it was based on defects in the contractor's work not on a White House political directive. Last Thursday, you issued a press release with this blaring headline quote, and I quote, "HealthCare.gov could only handle 1,100 users the day before launch," end of quote. This claim is wrong. You apparently based your allegation on misinterpretation of the documents we received, which relate to a sample testing environment. I believe the witnesses will expound upon that today. Most troubling of all was your allegation against one of our witnesses today, Todd Park, the Chief Technology Officer of the United States of America. You went on national television and accused him of engaging in a, quote, "pattern of interference and false statements," end of quote. Mr. Park is widely respected by the technology community as an honest and upstanding professional. In my opinion, your accusations denigrated his reputation with absolutely no legitimate basis. As I said in my letter to you on Monday, I believe your statements crossed the line, and I think you owe Mr. Park an apology, not a subpoena. The unfortunate result of this approach is that we may miss an opportunity to do some very good work. Our committee has done significant, substantive, and bipartisan work on federal IT reform, and I applaud you for your leadership in that. And I go back to the word. It was indeed bipartisan. We joined in to do what this committee is supposed to do, to look at the facts, to seek the truth, the whole truth, and nothing but the truth, and then bring about reform. Under the leadership of both you and our Democratic information technology expert, Mr. Connolly of Virginia, last March we passed the Federal Information Technology Acquisition Reform Act. This bill would increase the authority of agency CIOs and provide them with budget authority over federal IT programs, including hiring. We did that together. We did that in a bipartisan way. We should put politics aside, roll up our sleeves, and work together to constructively address these challenges. I hope that that's what today's hearing is all about. And I again thank our witnesses, who I know are working very hard to achieve these goals. And with that, I yield back.
I thank the gentleman. Members may have 7 days in which to submit opening statements and other extraneous material. I now ask that my entire opening statement be placed in the record. Without objection, so ordered. I now ask that the letter from Mr. Cummings, dated November 6, 2013, to me be placed in the record. Without objection, so ordered. And I will now go to our panel of witnesses. We welcome our first panel of witnesses. Mr. Dave Pauner is the Director of Information Technology Management Issues at the Government Accountability Office. Mr. Henry Chow is the Deputy Director of the Office of Information Services at the Center for Medicare and Medicaid Services, for the today probably called CMS for the rest of the day, and Deputy Chief Information Officer at CMS. Mr. Frank Bateman is the Chief Information Officer at the Department of Health and Human Services, normally called HHS. Mr. Todd Park is the Chief Technology Officer of the United States. Mr. Steve Van Rokel is the Chief Information Officer of the United States. Okay. And pursuant to the rules, as many of you who have not been here before will see, I'd ask that you all rise to take a sworn oath. Please raise your right hands. Do you solemnly swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth? Let the record, please be seated. Let the record reflect that all witnesses answered in the affirmative. Now, this is a large panel. It's going to be a long day, and I suspect witnesses will be asked questions by both sides of the aisle. So I would ask that, since your entire opening statements will be placed in the record verbatim, that you adhere to the time clock and come to a halt as quickly as possible when it hits red. Please understand, yellow is not an opportunity to start a new subject. It is an opportunity to wrap up. And with that, we'll go to our distinguished guest from the GAO, Mr. Pauner.
Chairman Issa, Ranking Member Cummings, and members of the committee, we appreciate the opportunity to testify on best practices that help agencies deliver complex IT acquisitions. In July, I testified before Chairman Mica's subcommittee on 15 failed IT projects and other troubled projects. And now we are faced with one of the more visible troubled IT projects in HealthCare.gov. These complex projects can be delivered successfully when there is appropriate accountability, transparency, oversight, expertise, and program management. We issued a prior report that showcases 7 successful IT acquisitions and what allowed them to be delivered successfully. This morning, I'd like to highlight best practices from that report and others that would have made a difference with HealthCare.gov. I'd like to start by highlighting the importance of FTARA, Mr. Chairman, specifically those sections that increase CIO authorities and strengthen IT acquisition practices. Starting with accountability, key IT executives need to be accountable with appropriate business leaders responsible for the project. This needs to start with department CIOs, and for projects of national importance includes the President's CIO. At HHS, CIO authority is an issue GAO reported on just last week. Transparency. The IT dashboard was put in place in June of 2009 to highlight the status and CIO assessments of approximately 700 major IT investments across 27 departments. About $40 billion are spent annually on these 700 investments, and public dissemination of each project's status is intended to allow OMB and the Congress to hold agencies accountable for results and performance. Surprisingly, recent dashboard assessments on HealthCare.gov primarily showed a green CIO rating. But interestingly, in March the rating was red, so something was wrong at that time. Third, oversight. Both OMB, department, and agency oversight and governance are important so executives are aware of project risks and assure that they are effectively mitigated. We have issued reports on OMB and agency tech stat sessions highlighting the importance of these meetings and their excellent results, primarily halting, rescoping, and redirecting troubled projects. We have also recommended that more tech stats need to occur on troubled and risky projects. We are not aware that HealthCare.gov was subject to a tech stat review. Fourth, expertise. It is extremely important to project success that program staff have the necessary knowledge and skills. This applies to a number of areas, including program management, engineering, architecture, systems integration, and testing. And fifth, program management. Several best practices increase the likelihood that IT acquisitions will be delivered on time, within budget, and with the functionality promised. This starts with getting your requirements right by involving end users, having regular communication with contractors throughout the acquisition process, and adequately testing the system, including integration, end-to-end, and user acceptance. There are a number of key questions that can be asked of any IT acquisition to ensure that appropriate accountability, transparency, oversight expertise, and program management is in place, and these most definitely pertain to HealthCare.gov. These include, what role is OMB playing in ensuring that this major acquisition is on track, and specifically how involved is the Federal CIO? Is the department and agency CIO accountable and actively involved in managing risks? Is the acquisition status accurate, timely, and transparent as displayed on the IT dashboard? Are OMB and agency oversight and governance appropriate? Were governance or tech stat meetings held with the right executives? Were key risks addressed? And was there appropriate follow-up? Does the agency have the appropriate expertise to carry out its program management role and other roles it is to perform? In the case of HealthCare.gov, a key question is whether CMS has the capabilities to act as the systems integrator. And finally, is the program office following best practices throughout the acquisition lifecycle, starting with how the project is defined to how it is tested and deployed for operations. This would include security testing, assessment, and authorization. In summary, Mr. Chairman, OMB and agencies can do more to ensure that the government's annual $80+ billion investment in IT has the appropriate accountability, oversight, transparency, and best practices to deliver vital services to American taxpayers. This concludes my statement. Thank you for your continued oversight of Federal IT issues.
Thank you. Mr. Chow.
Good morning, Chairman Issa, Ranking Member Cummings, and members of the committee. Since the passage of the Affordable Care Act, CMS has been hard at work to design, build, and test secure systems that ensure Americans are able to enroll in affordable health care coverage. I serve as CMS's Deputy Chief Information Officer, and I am a career civil servant that has 20 years working at CMS on Medicare and Medicaid systems of varying scales. My role has been to guide the technical aspects of the marketplace development and implementation, the federally facilitated marketplace eligibility and enrollment systems, and the data services hub. I work closely with the private sector's contractors building these IT components of HealthCare.gov. I also work closely with my colleagues in CMS who handle other IT and policy aspects of the site, including the Center for Consumer Information and Insurance Oversight, which manages the business operations and makes policy decisions that relate to HealthCare.gov, the Chief Information Officer, who oversees the account creation on HealthCare.gov through management of a shared service called the Enterprise Identity Management System, and the Office of Communications, which is focused on the call center operations and the user experience aspects of HealthCare.gov. To facilitate the various key functions of the federally facilitated marketplace, CMS contracted with QSSI to develop the hub and CGI Federal to develop the federally facilitated marketplace. The hub facilitates the secure verification of the information a consumer provides in their marketplace application with information maintained by other federal data sources such as SSA and IRS. In addition to the hub, CMS contracted with CGI Federal to build the federally facilitated marketplace system, which consumers use to apply for health care coverage through private qualified health plans and for affordability programs like Medicaid CHIP and premium tax credits, advanced premium tax credits, and cost-sharing reductions. The federally facilitated marketplace system consists of numerous modules, each of which was tested for functionality and for security controls. Numerous test cases were used to exercise the end-to-end functionality of the system. We underestimated the volume of users who would attempt to concurrently access the system at any one time, initially in October, and we immediately addressed the capacity issues in the first few days and continue to actively work on further improving performance and creating a better user experience. HealthCare.gov is made up of two major subdivisions. One subdivision is called Learn and contains information to assist and educate consumers about the marketplace. In addition, a premium estimation tool was launched on October 10th to allow consumers to browse health plans without creating a HealthCare.gov account on the Get Insured subdivision of HealthCare.gov, which contains the online application for enrollment. While the premium estimation tool could only sort consumers into two age categories when it was first launched, its functionality will be expanded to accommodate additional scenarios to better fit consumer shopping profiles. This tool is different from the FFM application because determinations about consumers' eligibility for insurance affordability programs, Medicaid and CHIP, are specific to the characteristics of an applicant and his or her household and can only be calculated when an application is completed, after income, citizenship, and other information is verified. I know that consumers using HealthCare.gov have been frustrated in these initial weeks after the site's launch. While the hub is working as intended, after the launch of the FFM online application, numerous unanticipated technical problems surfaced which have prevented some consumers from moving through the account creation, application, eligibility, and enrollment processes in a smooth and seamless manner. Some of those problems have been resolved, and the site is functioning much better than it did initially. Users can now successfully create an account and continue through the full application and enrollment processes. We are now able to process nearly 17,000 registrations per hour or 5 per second with no errors. Thanks to enhanced monitoring tools, we are now better able to see how quickly the online application is responding and to measure how changes improve user experience on the site. We reconfigure various systems components to improve site responsiveness, increasing performance across the site, but in particular the viewing and filtering of health plans during the online shopping process. We've also made software configuration changes that have added capacity to improve the efficiency and effectiveness of the system. CMS is committed to creating a safe, secure, and resilient IT system that helps expand access to quality, affordable health care coverage. We are encouraged that the Hub is working as intended and that the framework for a better functioning, federally facilitated marketplace eligibility system and enrollment is in place.
I know this isn't questioning time, but if you can tell us 17,000 are signing up per hour, then why is a subpoena from Ways and Means unanswered as to how many have signed up? Please, don't answer yet. We'll get to that. Mr. Bateman.
Good morning, Chairman Issa, Ranking Member Cummings, and members of this committee. My name is Frank Bateman, and I am the Deputy Assistant Secretary for Information Technology and the Chief Information Officer at the U.S. Department of Health and Human Services. I'm pleased to join you here today. The Department of Health and Human Services is the United States government principal agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. At the Department level, the Office of the Chief Information Officer serves this objective by leading the development and implementation of an enterprise-level information technology framework. HHS is committed to the effective and efficient management of our information resources in support of our public health mission, human services program, and the U.S. health system. The HHS OCIO is responsible for developing the Department's policy framework for IT, including such areas as enterprise architecture, capital planning, records management, accessibility, and security and privacy. For example, the security arena has a healthy framework that encompasses the Federal Information Security Management Act of 2002, OMB directives, and the National Institute of Standards and Technology's guidance on security and privacy, all of which are embodied in the Department's security policies. Our information technology portfolio is sizable, including support to a number of grant programs that provide IT resources to state, local, and tribal governments in support of the programs administered by HHS. The Department's portfolio also supports everything from common and commodity IT, things like human resources, email, and accounting systems, to the mission systems that enable research at the National Institutes of Health, to the regulation of drugs and devices at the Food and Drug Administration, and to the treatment of patients at the Indian Health Services network of clinics. HHS is a large department with a diverse set of missions. Our operating divisions include the Administration for Children and Families, the Administration for Community Living, the Administration for Health, Research, and Quality, the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, known as CMS, the Food and Drug Administration, the Health Resources and Services Administration, the Indian Health Service, the National Institutes of Health, and the Substance Abuse and Mental Health Services Administration. That's what makes up HHS. And we manage our IT portfolio through a federated governance structure. The vast majority of the Department's IT resources are dedicated directly to the appropriations made to our programs and operating divisions, and our governance structure reflects that reality. Program-level IT decisions are governed and reviewed by our operating divisions. Each of HHS's operating divisions has its own Chief Information Officer, its own Chief Information Security Officer, and an IT management structure. And management of the development of HealthCare.gov was comparable to management of similar IT initiatives throughout the Department's operating divisions. Indeed, prior IT initiatives that we're all familiar with, including Medicare.gov and Medicare Part D prescription drug program, were led and developed by CMS, who serves as the business owner and developer of HealthCare.gov's integrated eligibility and enrollment system for the federally facilitated marketplace. Since I joined the Department about 18 months ago, we have been working to restructure and update our IT governance, bringing visibility into what the Department buys and builds across all of our operating divisions. And we are now in the process of putting in place 3 IT steering committees to bring together technology and program leaders from across the Department to improve our purchasing and management of IT resources. These steering committees take a functional view of our IT portfolio. We have created one to oversee health and human service systems, a second to oversee scientific research systems, and a third for administrative and management systems. This governance structure will improve department-wide oversight of IT purchases and projects. Secretary Sebelius has been a strong advocate for transparency into the Department's IT portfolio, and this new governance structure is designed to achieve that outcome. Collectively, these 3 steering committees will provide department-wide guidance to the operating divisions' respective IT portfolios and will ensure that we identify and take advantage of opportunities to save taxpayer funds. For example, we are now in the process of establishing a vendor management office to improve the Department's negotiating position with technology vendors and to make use of enterprise-wide license acquisitions. We are always looking for ways to consolidate investments, systems, or acquisitions to meet the Department's broad IT portfolio needs more effectively and economically. In the FY14 budget process, HHS identified $250 million in reductions within our IT portfolio attributable to savings in various commodity IT areas.
Mr. Bateman, we know how great a job you are doing. That is why you are here today. Could you please wrap up?
Sure. I appreciate the opportunity to be with you here today.
Thank you.
Yep.
Mr. Park.
Good morning, Chairman Issa, Ranking Member Cummings, and members of the committee. Thank you for inviting me to testify today on the Administration's ongoing efforts to deliver on the promise of the Affordable Care Act. As U.S. Chief Technology Officer, housed at the Office of Science and Technology Policy, I serve as an advisor at the White House on a broad range of technology policy and strategy priorities, ranging from how technological innovation can help grow the economy, to how to open up government data to spur innovation and entrepreneurship in the private sector, to how the power of technology can be harnessed to improve health care, aid disaster relief, fight human trafficking, and more. In this work, I try to bring the sensibilities of the private sector tech entrepreneur that I've been for most of my professional life. As you know, October 1st was the launch of the new HealthCare.gov and the health insurance marketplace, where people without health insurance, including those who cannot afford health insurance and those who are not part of a group plan, can go to get affordable coverage. Unfortunately, the experience on HealthCare.gov has been highly frustrating for many Americans. These problems are unacceptable. We know there is real interest from the American public in having easy access to the new, affordable choices in the health insurance marketplace. I believe that as public servants, we have a shared goal: to deliver to Americans the service they deserve and expect. And since the beginning of October, I have shifted into working full-time on the team that is working around the clock to fix HealthCare.gov and bring it to the place it should be. The team is making progress. The website is getting better each week as we work to improve its performance, its stability, and its functionality. As a result, more and more individuals are successfully creating accounts, logging in, and moving on to apply for coverage and shop for plans. We have much work still to do, but are making progress at a growing rate. I'll be happy to try to answer any questions you may have about HealthCare.gov and the progress the team is making. Thank you very much.
Thank you, Mr. Park. Mr. Van Roekel.
Good morning, Chairman Issa, Ranking Member Cummings, and members of this committee. Thank you for this opportunity to testify on the efforts to improve the management of Federal information technology and its relationship to the implementation of the Affordable Care Act. As the Chief Information Officer of the United States, I serve as the Administrator of the Office of Electronic Government and Information Technology, a statutorily created office within the Office of Management and Budget. My primary duties are developing and issuing government-wide broad-brush guidance and policy, overseeing the development of the President's $82 billion IT budget, and convening and facilitating Federal IT stakeholders to collectively address and resolve complex cross-government issues. The results from my office have followed these themes: flatlining Federal IT spending since 2009, realizing over $1 billion in savings since 2012 with our Portfolio Stat program, and facilitating and convening agencies to work on cross-cutting opportunities in policy, such as our work on opening government data, closing and optimizing our data centers, promoting a new wave of cloud computing. My office has also done important work in the area of cybersecurity, creating new secure mobile device specifications for our country and protecting Federal IT devices and the network. My involvement in the implementation of the ACA also reflects from my role as Federal CIO. I acted as a convener and facilitator of agencies to work through the technical details of the cross-agency implementation work of the ACA, primarily yielding the Cross-Agency Data Service Hub feature of the overall system. As the committee is well aware, before joining the administration, I worked in the private sector for nearly 20 years, the majority of which was at Microsoft Corporation. I shipped and helped launch many complex products and well-known brands, such as Windows XP, Xbox, and Windows Server. The launch of each of these projects presented its own challenges. Microsoft is still patching Windows XP 12 years after I helped launch it in 2001. Continuous improvement is the nature of these efforts. As you can imagine, connecting multiple legacy IT systems across multiple agencies of the Federal Government is a complex task. However, this is no way an excuse for the problems encountered in launching HealthCare.gov. We are taking this unacceptable situation seriously and working hard to correct course. Since October 1st, I am actively helping in the all-hands-on-deck effort to assist the Department of Health and Human Services and the Centers for Medicare and Medicaid Services in fixing this system. Given my prior experience in the private sector, I acted as a customer advocate, helping to assess and address opportunities to improve the customer experience while we fix the website. Outcomes from this work include updates to the homepage of HealthCare.gov and listing alternative ways to apply for health insurance. Recently, I am involved in the technical aspects of the site, including monitoring progress and advising the team. We share the deep concern of this committee regarding the current state of HealthCare.gov, and we as a team are working to improve this site, to improve access to affordable health care coverage as soon as possible. I look forward to continuing this work after this hearing. Thank you again for the opportunity to appear before the committee today.
Thank you. I now ask unanimous consent that pages 151 and 152 of Mr. Chow's transcribed interview placed in the record. Without objection, so ordered. I now ask that the redacted document of CGI Federal, which we'll call Exhibit 1, I guess, be placed in the record. Without objection, so ordered. And I now ask that the CMS document entitled Health Insurance Marketplace Pre-Flight Checklist, September 25th, 2013, be placed in the record. Yes.
I just want to reserve so I could just see the documents. That's all.
That's a committee document that both sides have. Without objection, so ordered. Mr. Chow, I'm going to ask the clerk to give you those documents, and I'm going to give you a very brief, before I start, I'm going to very brief understanding of what I'm going to come back to you on in just a few minutes. But you've made testimony on pages 151 and 152 of your transcribed interview in a sequence of events that were related to the minority's questioning of you as to whether or not the anonymous shopper function worked on October 1st. The other document is related to that checklist, and we want to make sure you have that before I ask you any further questions under oath. And while he's reading that, start the clock, please. Mr. Park, you're here today and taken away from your other duties because of a serious concern about what you knew and what the administration may have had you say. And I want to give you an opening opportunity to clarify that. After the October launch, and I'll paraphrase, you basically said that the problem with the website was that there were 250,000 simultaneous users. They could have handled 60,000, but that 250,000 simply slowed it down or brought it to its knees. With your opening statement, the opening statements of others, and what you now know, would you like to please, for the record, give us the number of simultaneous users you believe could have been handled through the portal on day one?
Thank you, Mr. Chairman, for the question. It's the nature of this kind of situation.
Now, Mr. Park,
yes, sir.
I want to treat you with respect.
Yes, sir. Yes, sir.
But I've got a very few minutes.
Yes, sir.
You gave a number. That number was erroneous. It couldn't handle 60,000 simultaneous users. Documents that will be placed in the record show that on September 30th, the system crashed with 1,100, and the goal was to get to 10,000. Would you like to tell us, for the record, based on your working on this, what number the American people could simultaneously be on the site working on day one before the system began to time out?
To answer as succinctly as I can, thank you for the question. The information that we had at the time was that CMS had designed the system for 50,000, 60,000 concurrent users. Right now, if you ask me right now, based on what I know now, what the system is currently capable of handling, the thing I would be comfortable saying is that the system has been comfortably handling, at present, about 20,000 to 25,000 concurrent users.
Okay, so it's fair to say, and I'll paraphrase, on day one, on October 1st at the launch, some amount, perhaps greater than 1,100, which was experienced on September 30th, and closer to the goal set on September 30th, which they thought, in documents the committees received, they could get to 10,000 simultaneous, that on day one, on October 1st, when this site launched, the site was capable of handling somewhere more than 1,100 perhaps, but less than 10,000 simultaneous users, and certainly not the 60,000, 50,000, 20,000, or 250,000 that simultaneously tried to use the site. Is that correct?
So there may be a matter of confusion here with which CMS may be better positioned to clarify.
Okay, well,
I believe that the 1,100 number was for a particular unit of capacity, as opposed to the entire system. But I will
right, but the problem is there was a front door, and that unit of capacity was limited by the front door. You know, I think and I come out of the IT world, I come out of the tech world, but the American people can understand that you're only as strong as your weakest link. If you have a bottleneck that causes people trying to get through the site to not be able to do it, to time out, that bottleneck is what determines it. And since on day one only 6 people got to the end, I think that for the American people, understanding that whatever the capacity is today, the capacity was insufficient on day one. Isn't that correct?
So, sir, just in the interest of providing the most accurate testimony I can.
Now, I only want to know, on day one, was the capacity sufficient?
I can't speak to the numbers that you were talking about, but clearly on day one, the system was overwhelmed by volume.
Okay. Well, Mr. Park, you're going back to something I'd hope you wouldn't do. The volume on day one, and maybe the GAO can answer, the volume on day one was not in excess of what was expected, was it? The volume on day one was what you would expect if everyone's going on the site to see what it's all about after 3.5 years of waiting, isn't it, Mr. Browner?
Yeah, Mr. Chairman, I don't have those specifics, but I will say this. These volumes we're talking about, if you go to examples like IRS on e-filing and the volume they handle with people filing taxes in the 11th hour, this is the same problem that IRS deals with on an annual basis. And what you need to do is you need to appropriately plan for your performance and stress testing, and there's fundamental questions whether that was adequate here.
Well, and that's what we're going to discover throughout the panel today. Mr. Chow, I told you I'd come back to you. You testified under oath on pages 151 and 152 on the minority's questions that basically, and I'll paraphrase because of time, this site, the anonymous shopper function, did not work. Now, we've seen a document with CMS on it dated in the last day, in September 25th, that said it passed that test. Is it that you did not know it had passed the test when you made your statement saying that it failed?
Well, first off, Chairman, I'd like to say that after working with your staff for 8, 9 hours, as well as the minority staff, going through this transcribed interview, I've not had a chance to look at this. So this is the first time I'm actually seeing the results of that day. So,
look, your job is to know what's in the site. The CMS report that said, and this is September before the launch, that you had the test had been passed successfully on the anonymous shopper. You testified that it wasn't, and that's why it was turned off.
Correct.
Are you prepared to say that, under oath, that the anonymous shopper was turned off by your knowledge, not your guess, not your hypothetical, but are you prepared to say the anonymous shopper was turned off because it failed the test? And that would be your knowledge based on what you knew.
my words were not that it was turned on or off. I think that's actually technically incorrect. I said it was not made available because it failed testing. So you hand me this page 151, 152, which I have not reviewed just for correctness and accuracy, and I suppose you're handing me this other document that says—
Mr. Chow, what we're doing is we're saying that CMS documents show that the anonymous shopper tested positive. It worked. You said under oath, and I'm sorry that you may not have remembered what you said under oath, but when the minority asked you what is normally nice questions, self-serving questions, help you rehabilitate yourself questions, they're on your side, you said effectively that you gave a reason, which the ranking member used in his opening statement effectively,
Right.
that the anonymous shopper was turned off for reasons other than political.
Because I have—
We believe the anonymous shopper, the easy front door, I just want to know what it's going to cost,
Because when I
was not
answered—
on, and in fact, if it was on, Mr. Park has said, this had different components. That portion could have been much more effective. The American people could have gotten on and shopped.
This line of questions that I was answering about anonymous shopper is in the context of my knowledge, under oath, that it did not pass testing. And I have documents that show it did not pass testing.
Okay, so
this other
when
document—
Mr. Chow, my time has expired, but when HHS and CMS deliver us documents showing that it hasn't passed, we can have you back. Right now, the documents provided to us by the vendor show that it did pass on a CMS document. That document is placed in the record. If anyone would else like to understand that you've said it failed test, they said it passed test. This administration, in their absence of transparency, has refused to give us the document showing it failed test. But the document we have today, which says CMS all over it, which is in the record, says it passed test. It passed the test. You said under oath it failed the test. Our problem is the people you work for won't give us the document so we can fully understand that, just as the people you work for won't answer a simple question to the Ways and Means Committee, which is how many people have signed up, even under a subpoena. With that, I recognize the ranking member to try to rehabilitate your testimony.
Mr. Chairman, let me be clear that we have staff who work just as hard as yours. It's not about self-serving. It's about getting to the truth. And I would not insult your staff. And
I wasn't insulting your staff.
well, I take it as an insult.
What I said was that
It's not about self-serving. It's not about rehabilitating. It's about trying to get to the truth, period. The truth and nothing but the truth. And I'm not going to try to rehabilitate, as you said, Mr. Chow. And I think that there will be some documents.
Maybe you can get him to give us the
I think
document.
in a few moments, somebody else on this panel will present the documents that there's something that you did not disclose just now that will be brought out to show that your statements are inaccurate. Now, Mr. Park.
The gentleman yield.
Of course.
So what you're—
somebody else will bring it up. Another member of—
So somebody else will rehabilitate.
No. Again, we will show you the document that there's some things that have been blacked out that you have not disclosed, and we'll show you those in a few minutes. Mr. Park, and now if I may proceed. Mr. Park, although we have not met before today. I understand that you have an outstanding reputation in the IT community. I did not know this previously, but the co-founder of your former company is Jonathan Bush of Athena Health, who is the cousin of former President George Bush. Is that right?
Yes, sir.
I have a quote here that Mr. Bush, the cousin of the former president, gave to a reporter a few weeks ago, and he says this about you, and I quote, "Todd is uniquely thoughtful, dedicated, and precise. He's a manic problem solver, blind to partisanship. If there's anyone who can fix the problems with the exchanges, it's Todd." Mr. Bush also said that you are working so hard to improve the website that you, and I quote, "spent the first week of October sleeping on the floor of his office as he tried to help get HealthCare.gov off the map." Is that right?
Yes, sir.
Well, your reputation certainly precedes you. Unfortunately, however, last week, Chairman Issa appeared on Fox News and accused you and other political appointees of engaging in a, quote, "pattern of interference and false statements related to this site," end of quote. That's a serious attack against your integrity. I don't want to get into anyone's intent or motives here, but I do want to give you an opportunity to respond directly. And this is not unusual for me, because I realize that we are all on this earth for a short while, and that our reputations is all we've got. And since those statements were made about you, I would like to give you an opportunity to respond.
Thank you, sir. Thank you for the opportunity. And again, I don't take any of this personally. It's a fast-moving situation with a lot going on. So what I would just say is this: is that it was the case, absolutely, that volume was a key issue that hit the site. It's still an issue for the site, although we've greatly expanded and are expanding the ability for the site to accommodate volume. I relayed my best understanding at the time in each of my statements. It's the nature of things that as you do more painstaking diagnosis of a system, you learn more about what you need to do to fix it. And I can say now that in addition to volume, there are other key issues that have to be addressed with the site in terms of its performance, in terms of its stability, in terms of its functionality. And there are aggressive efforts happening to do that, which are making great progress. The site's getting better and better each week with the work of a tremendous team led by Jeffrey Zients and Administrator Taverner, of which I'm proud to be a small part. But you have my assurance that at each point along the way, if I'm ever asked a question, I will tell you what I know to the best of my ability and my best understanding. And that's what I'll continue to do as my understanding gets better and better.
Let me ask you this way. Did you engage in a, quote, pattern of interference and false statements, end of quote?
No, I didn't. I relayed my best understanding at the time, and I'll continue to do that. As my understanding gets better, I will relay that, absolutely.
Before you were subpoenaed to come here today, your office wrote a letter describing your extremely demanding workload for the next 2 weeks and offering to testify in December instead. Was this concern coming just from your office, or was it really a legitimate concern of yours that you would be pulled away from the website issues to prepare for testifying here today?
So it's never been a question of if I'll testify, it's just a question of when. It had been the hope of me and the team that's working to fix the site that I could continue to focus intensely on helping to fix the site this month and come back in a few weeks. That being said, I understand that the chairman came to a different decision. I respect that decision. I'm the son of immigrants from Korea. I have incredible love for this country. I have huge respect for the institution of Congress and its role in our democracy. And if the committee wanted me to be here today and decide I should be here today, then I'm happy to be here today and make the time to answer your questions.
Although I understand that the website
gentleman's time has expired.
Mr. Chairman, I just asked for the same amount of time you had.
I let you ask the last question after your time had expired. With that, and it was completed, we now go to the gentleman from Florida for 5 minutes.
Yeah, I know.
Mr. Chairman, can I just I think it was about almost 4 minutes that you exceeded your time by that. Is there
I went to one question after the end, which was Mr. Chow, which I gave in
4
advance.
minutes
You know,
on that?
look,
So I'm only asking is, of course, whether or not be slammed
Gentleman's
down
time.
here.
The gentleman's recognized.
So you're not going to run a fair hearing. You're just going to go out and do this all the way.
Mr.
The gentleman from
thank you.
Florida is recognized.
Thank you for yielding. It's kind of interesting to see as Obamacare implodes how everybody's running for cover. Yesterday we saw the former President of the United States, Bill Clinton, throw the current President under the bus, so to speak, on this issue. Today we heard the other side, Mr. Cummings, our Democrat leader, start out by citing that the problem with this is Republican governors, that a lot of them opted for an exchange. Mr. Chow, how many, well, are these governors Arkansas, Delaware, Illinois, Missouri, Montana? Aren't they all Democrat governors and they opted out of the exchange? Are you aware of that? Well, they are, just for the record. But it is interesting to see how they run for cover. I have a question for all of you. Do you, each of you, I want to ask you this question. It's obvious that Obamacare was not ready for prime time from both an IT performance ability and also from a security standpoint. Were you aware of that, Mr. Powner, before October 1st?
GAO did issue a report
Were you?
in June that there was a lot to do in a compressed schedule,
yes.
correct?
Were you aware of it, Mr. Chow?
Can you repeat the question again?
That Obamacare was not ready from an IT operational and also from a security standpoint for prime time on October 1st. Were you aware of it?
I was aware that there was security testing.
You were aware that there were problems.
And that there were no high findings
but
in security testing.
I said from an operational, so you thought it was operate just fine.
I'm just trying to answer your question.
Well, operational and security. Mr. Bateman.
I was aware that various modules that were to be part of the system weren't
working.
Mr.
Mr.
Park,
Park,
removed.
anything on security? Mr. Park? Operational and security.
As I recall, sir, no.
Oh, okay. Mr. Van Rokel.
I'm aware that any system, private sector or public sector,
What about the security?
needs constant addressing of security.
What about the security issues?
Any system needs constant security needs to be constantly addressed.
Did you review a document prepared by MITRE that reviewed, this hasn't been released yet, but it reviewed the security testing and capability?
No, sir, I didn't see that.
You did not see this,
No, sir.
September 23rd, that highlighted some of the issues. Okay. First of all, it looks like political decisions got us into this strait. And you commented, Mr. Chow, to our committee that you had to have regulations in place to go forward to make decisions and the construct, right?
Correct.
And there were regulations that were not imposed, and I think you also intimated that some of them were stopped by the White House prior to the election.
No, I did not.
Okay.
not
Mr. Chow,
intimate-
you said
I
the
did not
delay in
intimate-
issuance of regulations guidance was a significant problem in compressing the time frame, and actually, the White House pressured to stop those regulations coming out before the election because they didn't want folks to know what was coming. You're not aware of that?
Well, I think you're paraphrasing from my testimony.
Okay. Well,
which I
here's
have
your
not seen.
comment to our staff. You can't test the system without requirements. So if requirements are coming in late, then obviously you're going to be a little nervous. Was that your statement?
I think that holds true for any
That's what we
compressed
have.
timeframe.
That was your statement. Okay.
My answer in the context was for any development project that requires requirements in order to build the system in a compressed time frame.
You knew that, did you know that security had, and the testing was done by MITRE of security. Is that correct?
MITRE and Blue Canopy.
Okay, both respectable firms, and this is the MITRE report. And MITRE was, let me just take, MITRE was unable to adequately test confidentiality and integrity of the exchange system in full. Are you aware of that?
Well, that seems actually true and appropriate because the full system isn't built completely
And it was never
yet.
fully tested? Has it been tested?
No. I think what it's referring to is that there are other components of the marketplace program that still need to be built.
Sir, can you sit here and tell us that there are not heightened risks of unauthorized access, non-encrypted data, identity theft, and loss of personal identification
Gentleman's time has expired. You may answer.
And Mr. Powner, can he also answer to that?
That was my reply in response to a decision memo in which we wanted to generally highlight the potential risk that's applicable to any system of this magnitude that is servicing the public and collecting information about people.
Mr. Powner, if you had anything else briefly.
I think the key that your staff shared that document with me. I think the key is that was an early assessment, not on the complete system. And a key question going forward is what has been done in terms of security testing and assessment while the system continues to be built.
Thank you. The gentlelady from New York, Ms. Maloney.
Thank you. I'd like to thank all of the panelists for their public service and thank the Chairman and Ranking Member for this oversight hearing. There is a success story in the state that I'm privileged to represent, New York State. Nearly 50,000 New Yorkers have enrolled in health insurance plans through the New York State Health Program. Almost 200,000 New Yorkers have completed full applications on the New York State of Health. Additionally, the state's customer service center operators have provided assistance to more than 142,000 New Yorkers. And the rates for the plans represent a 53% reduction compared to the previous year's individual rates. And in addition to the cost savings, it's estimated that nearly 3/4 of individual enrollees will qualify for financial assistance. This is according to an official state report from New York. So this is certainly good news, but we do need improvements on the Federal user experience. And I'd like to ask Mr. Park, have improvements been made daily on the website? Are you working to make improvements every day?
Thank you so much for the question, and it's terrific news coming out of New York.
Yeah.
So the answer to your question is that people are working every day to make things better. I would say the site's getting better week by week. Some days are better than others, but if you look at the trend line week over week, things are getting better. So for example, one metric of the user experience is what's called system response time. This is the rate at which the website responds to user requests, like displaying a page that you want. Just a few weeks ago, that rate was on average 8 seconds across the system, which is totally unacceptable. It's now actually under a second today. Another metric of user experience.
Well, that's really good news. How much faster can the public expect the website to be? Now you're under a second, is that what you said?
On average, yes.
On average?
Yes.
Well, can the public
pages take
expect,
longer than that.
can you make it any faster than a second?
Yes, the team believes that it can. And again, it's the team doing this work. And we're most of the way, I think, in terms of average response time we want to be. We want to get it down further. We're also actually, thanks to monitoring
So I would say that reducing wait time has become a priority, right? And that certainly will help enrollment numbers, don't you think, Mr. Park?
That's right. Yes, ma'am.
Okay, yes, great. That's terrific. Now, are accounts registering properly at this time? Was that problem solved?
That problem has actually largely been solved. That was, of course, a significant problem up front that folks experienced. But thanks to expanded capacity, thanks to system configuration changes and code fixes, that problem has largely been solved. People can actually get through the front door and begin the application process and start shopping for affordable health options.
So how many registrations can the system handle now? Congratulations on solving that, by the way.
So I believe that the latest number, the team's report, is about 17,000 registrations an hour, and the plan is to actually up that in terms of new accounts being created. And then, of course, people who have registered previously are coming back and coming back and coming back to keep working on their application, shop for plans, et cetera.
And how are you reaching out to people who may have been discouraged and encouraging them to come back and try again? Is there any effort to reach out to them, or just the notices that it's happening?
Yes, ma'am. So CMS is currently engaged in an effort to begin to reach out to folks who actually got stuck
Really?
in that account creation process, and encouraging them to come back and make it through the front door and start applying for coverage.
Are there resources there to help people navigate the process? I'm hearing they're confused often. Is there any resources there to help them figure it out?
Yes, ma'am. There's help text. There's also the call center. And the team is also working quite vigorously to keep improving the user interface and the flow so that you need less help, so that it's more and more clear to you at particular points what to do.
And how are you assessing or distributing the feedback that you're getting from users that have used the system and want to tell you how they could make it faster? But I don't see how you could make it any faster than a second, quite frankly.
Well,
but how are you communicating that feedback from users?
You can make it faster, by the way, and so people are working on that. There's feedback coming from a variety of different sources, from users, from folks in the field, from the call center, from testers, and that's actually being fed into a list dynamically kept on an ongoing basis of things to do in priority order to make the website better and better.
And I understand that the hub, the data hub, is working well. Is that correct?
The hub's worked extremely well from day one. It supports actually not just the federal marketplace, but all the state marketplaces, including New York's great success. And that continues to hum along very nicely.
Well, thank you. My time has expired, and I see that sleeping on the floor is paying off in your hard work. Thanks.
It's the team. It's the team. I'm just a small part of it. The team is doing work.
Your team. Congratulations. Thank you.
The team. I'm a part of the team.
I thank the gentlelady. We now go to the gentleman from Tennessee, Mr. Duncan.
Thank you very much, Mr. Chairman. And while I am very skeptical about the government's ability to run our health care system, what I'm more concerned about or object to more is all the sweetheart insider deals that government contractors get under these programs, and all the people and companies that are getting filthy rich off of these programs. And I have an estimate here on the cost of all the technology that was the estimate of OMB as of August 30th, before all the problems surfaced, and they said we would spend $516.34 million on the technology. Now we've seen estimates way above that, and so I have a question about that, about how much all this is going to cost us to straighten this out, and are these going to be continual costs each year? Or are we going to have to spend more and more and more on the technology? But secondly, and a greater concern, I have two stories here, one from the Washington Post of about 10 days ago, and one from CBS News a couple of days later. And they say the administration knew 3.5 years in advance that these problems were going to occur. The Washington Post story says in May 2010, 2 months after the Affordable Care Act squeaked through Congress, President Obama's top economic aides were getting worried. Larry Summers, director of the White House's National Economic Council, and Peter Orszag, head of the Office of Management and Budget, had just received a pointed 4-page memo from a trusted outside health advisor. It warned that no one in the administration was up to the task of overseeing the construction of an insurance exchange and other intricacies of translating the 2,000-page statute into reality. So what I'm asking, and I would welcome comments from anybody on the panel, how much is all this going to cost to straighten out these problems that we now know that we have? And secondly, how long is it going to take when the administration or y'all have had 3.5 years warning that this was going to happen? How much longer is it going to take us to straighten all this out?
Mr. Browner, you seem to be giving the best answers.
I can comment on the cost figure, what we know to date. If you look at OMB documentation, there are exhibits where you report spending by fiscal year, and through the fiscal year 13, so by the end of September, it was north of $600 million spent. Now, I will caveat that by saying that did include IRS costs associated with that and some other government agencies. It wasn't just all CMS and HHS. But your question about what it's going to cost to fix, that's where we're kind of blind to that, and I think that's a key question, how much that will end up being.
All right. Does anybody know if we've spent $600 million already and it's not working? Does anybody have any idea how much all this is going to cost us in the end? Nobody knows? What about how long is this going to, how long, then go to the second question, how long is all this going to take if you've had 3.5 years to get ready for this, and we hear all these promises about you can keep your plan, you can keep your doctor, your health care costs or premiums are going to go down about as much as $2,500, and we now know that all of that was false or incorrect. How much longer is it going to take us, another 3.5 years to get this straightened out?
I think it's important to note, sir, that Americans are getting insurance today, that the system is passing through and people are registering. And the focus today, as I said in my opening statement, is about continuous improvement and making sure that we make that even better and stronger, and that
well, they're getting insurance, but millions are getting their policies canceled, and millions are getting sticker shock because of premium increases too. But I'm just wondering, what I'm asking about is all the technology. I mean, if we've had 3.5 years that the administration has known that this was going to happen, and they couldn't fix it in 3.5 years, how much longer is it going to take us?
Would the gentleman yield?
Yes, sir.
Well, you know, we have two distinguished individuals from the private sector, and I would suspect that at Athena and at Microsoft that they knew what their burn rate was, they knew what their time was. In fact, neither of their companies would exist if they had launched their product working quite like this. Even Windows Vista launched better than the Obama website. But the gentleman could include their experience in the private sector if they'd like to compare this launch with the launch of each of their companies.
So I think it's important to note on this is the way that federal budgeting and federal IT is managed and empowered, and I think FITARA actually emphasizes this as well as many of the memos and things that I've put out, is empowering agencies to do their mission work, to execute against the budget. We formulate the budget within the Office of Management and Budget, and then the Congress and the appropriators actually grant that budget to the agencies to then execute. And the tools that we build to track spend, to make sure that diligence is happening on that, are all about empowering the agency to make those smart decisions about what they do. So in the private sector, it's not directly parallel because you're not, from our position, aren't on the ground actually running these programs day to day.
Yeah, you're begging an angel capitalist to give you one more chunk of money that he may or may not give you. With that, we go to the gentlelady from the District of Columbia for her 5 minutes.
Thank you, Mr. Chairman. And although you've called witnesses who are being asked to fix a plane while it's in the air, I do believe oversight is appropriate in light of the round of surprises we have had. And let me try to clear something up, Mr. Chairman. There was, for Mr. Chow, got a round of questions about the pre-flight checklist that, and I do have a document that said testing successfully, yes. I don't know if that means conducted a test or what, because if you look more deeply into the document, and you didn't have this before you, where you have the CGI checklist, their defect report, it is entirely consistent, Mr. Chow, with what you have said, because this defect report says there were 22 defects.
Would the gentlelady make that document available?
I would be glad to make this available to you and to the press. Now, let me, I'm also troubled by how the committee often pulls the White House into these matters without any evidence. The White House, in this case, the rollout is accused of not knowing enough, and now they've been accused of directing matters with respect to the shopper function, the anonymous shopper function. Even the chairman has said that publicly on television. So I'd like to ask Mr. Chow about that issue. The this notion, and the question really has to do with whether you were forced to register and then shop, whether that change was made from shop then register to register then shop, whether that change was made because of the involvement of the White House in any way.
Absolutely not. It was a decision made on the results of testing. It would be pretty egregious, and I understand that a lot of folks are wondering why the website is functioning the way it is, but to consciously know that it failed testing and to then put it into production for people to use is not what we do. We use the best available information, and if the test results show that it's not working, we don't put it into production.
Well,
Would the gentlelady yield?
I certainly will, Mr. Chairman, if you will make sure I get my time back.
Of course. Would you stop the clock? You know, the gentlelady's information, I've been told the one that you're referring to is in fact a roll-up to the decision that it had passed. In other words, your document is not inconsistent with it. I think Mr. Van Rokel made it clear that they're still fixing XP after they no longer support it. So I think the conclusion of the document is clear. You're asking Mr. Chow, he's still saying that this thing failed the test. Well, in fact, documents show it passed the test. Was it perfect? No. But if you could only get 6 people registered on day 1 and only 240 registered on day 2, some might say that the website was not passing the test in those first 2 days either. So hopefully that document, you can make it available to all of us, but I've been told that that is simply the part of the supporting documents for the conclusion that CMS has in their own documents, which is that that portion which was excluded, and we've been told in testimony that in fact they were told by people at CMS to turn it off, and that those people were being instructed by people at the White House.
All right, well, let me clear that up, Mr. President.
Okay.
I mean, Mr. Chairman.
I just want you to understand that
Well, Mr.
contractors
Chairman,
told us
let's look
that.
at the document. Let's have people look at the fine print and decide whether or not when these 22 defects were noted, because I got it in black and white here. Now, you say the White House did not say to turn off the anonymous shopper, Mr. Chow. Was that your testimony?
Yes.
Because the allegation of the chairman was that the White House ordered it because they wanted to avoid sticker shock. And I remember seeing that on, I think, television. Now, just let me ask you, let me say something about sticker shock. I had a staff member to go on just to test D.C. Health Link, which is where we all will have to go, and she found that the same they had 267 different policies, insurers on D.C. Health Link, and she found that the same Blue Cross Blue Shield she is now getting from the Federal Employment Program, she can get for between $160 and $220 less. So if there's sticker shock, at least some people are finding sticker shock works the other way. Now, but I want to drill down on this decision from the White House. Was there a White House directive that because the decision came not because, I want to make sure your testimony remains, because there's been some difference the Chairman cited, that there was no White House directive, but the reason for pulling the anonymous shopper was because the function failed testing. Is that continue to be your testimony?
Correct. If we would have put it into production, even though it's anonymous shopping or browsing, it requires some attributes about your preferences, your demographics, to approximate potentially what premium tax credit ranges you would qualify for, so that you can then move into shopping or plan compare. It didn't work in either calculating the approximate premium tax credit, nor did it work in Plan Compare. So if we allowed people to go through that, they would have gotten erroneous information, and that would have been much worse than not having it at all.
And I've already pointed to a document, and by the way, this document is from September. Now, did you get
The gentlelady, whose time has expired, would you briefly finish?
Did you get any direction from the White House to disable or to delay the shopper function, and were there any political considerations that went into your decision to do so?
None whatsoever. I look at the facts of whether if a system is going to be ready, and of course, not everything is always 100% perfect, and there are certain tolerances, but in this case, it failed so miserably that we could not consciously let people use it.
Thank you, Mr. Chairman.
Thank the gentleman. We now go to the gentleman from North Carolina, Mr. McHenry. Could you yield for just 10 seconds?
Happy to.
Thank you. Mr. Chow, if it couldn't calculate the prices properly, is it your testimony that when people went through the back door, those 6 that got through on the day 1, that it did calculate what their plan and let them shop through another part, a completely different portal?
If you don't go through what was...
No. I've taken 6 seconds for the man, and I don't want to go past a few seconds.
If you fill out an online application and you put your information in, you get an eligibility determination, you ask for financial assistance.
Yeah, you go through everything, but you're saying you didn't get the right price through the same software that would determine the right or wrong price.
Anonymous shopping was using different software.
Oh, yeah, okay.
Different software.
Well, that remains to be seen. Mr. McHenry, thank you.
Mr. Chow, all my constituents care about and want to know is when they log on, is their data, all their personal identifiable information, is that as secure as if they do online banking?
It was designed, implemented, and
I mean, that's a yes or no question.
It was designed, implemented, and tested to be secure.
So it was fully tested in best practices under the Federal Government standard for IT proposals?
Correct. The security controls assessment testing conducted by MITRE and another company.
Okay. So it's fully tested as the other IT projects you've overseen into that same standard?
I'm trying to understand what you mean by fully tested. It was tested in accordance
Fully tested? Holy cow, this is like a new low. Okay, then let me use the best practices are a complete integrated testing. Is that correct?
It is tested and prescribed under the FSMA framework and NIST controls that are specified as a standard.
Okay. So why did your office, well then, why did your boss resign?
He didn't resign.
Okay. So due to security readiness issues.
I think he decided to make a career change, which I can't speak to.
I think it was a fantastic time to hightail it out after this great rollout. So let me ask another question. So Marilyn Tavenner signed the Authority to Operate Memorandum. Traditionally, would your office sign a memorandum, or have you signed previous memorandums on authority to operate?
Myself, I have not.
Has your boss or previous boss?
Not that I know of, but okay. I do not manage the ATO sign-off process. That's done between the Chief Information Officer and the Chief Information Security Officer.
Okay. And they would traditionally do it, not the CMS administrator?
I think you would have to ask them.
Okay. Fantastic. We plan to do that. So let me ask you, Mr. Park, you said on USA Today on October 6th, quote, "These bugs were functions of volume. Take away the volume and it works," referring to HealthCare.gov. It was in the 4th paragraph. Do you still stand by that statement?
Thank you for the question. What I was specifically referring to...
No. Do you still stand by... Mr. Chairman, I ask unanimous consent to submit this for the record. Have you seen this USA Today?
Without objection, so ordered. And the question is on the statement, not on what you would want someone else to believe
These bugs
today.
were functions of volume. Take away the volume and it works. Do you still stand by that?
So I stand by the fact that the bugs that the reporter was referring to, which were issues users were experiencing in account creation up front, were in fact functions of volume. What I will say now, based on additional understanding, is that in addition to volume, which was a challenge, the account creation process was, we later on, also affected by particular functionality bugs, which have been fixed, most of which have been fixed, along with volume capacity expansion and other system configurations actually help handle more volume.
Let me tell you a story.
So,
I've got a woman named Sue who logged on. She filled out everything else. She did not fill out her middle initial. She got a processing error. She went back to try to fix it, put in the middle initial. She had to wait 48 hours to get another update. Turns out that her income was not verifiable because she put in a monthly income. She calls a navigator. The navigator says, yeah, we've got some problems with that. Maybe you can do it on an annualized basis. Well, unfortunately, she couldn't get back into the system, so then has to call back for another navigator, and the navigator says, gosh, we've got a little issue here. So let me try an annualized income and put it in on the back side, the back end that navigators can do. She's still waiting. She started on October 1st. She is still waiting to be successfully logged in to this website that you said has these bugs were functions of volume. Take away the volume and it works. This is such a deeply flawed data rollout. And my constituents are most concerned about trying to sign up, much less when they do sign up that they don't have their data stolen. And so, Mr. Chairman, I yield back.
Thank you, gentlemen. Mr. Park, you could answer if you see a question there.
That would be great. Thank you. So I was actually talking specifically about issues with account creation. There are issues downstream as well. And again, each time I speak with you, each time I speak, I will relay the best understanding I have and try to be as precise as I can be.
I thank you. We now go to the gentleman from Virginia, Mr. Connolly.
Thank you, Mr. Chairman, and let me begin on a bipartisan note. Mr. Chairman, you and I helped write, joining together, the FITARA Act requiring reform of IT acquisition, Federal IT acquisition. Mr. Van Rokel, you seem to have been equivocal, maybe, at our last meeting in January when you testified here, but I want to read to you a statement by the President of the United States. He said just recently, one of the lessons learned from this whole process on the website is that probably the biggest gap between the private sector and the Federal Government is when it comes to IT. How we procure it, how we purchase it, this has been true on a whole range of projects. A reasonable inference from that statement could be drawn that perhaps we do need some more legislation, some new legislation to free up some of the moribund rules in the Federal
Would the gentleman yield?
If
of course.
could freeze my time.
I couldn't agree with you more that, in fact, one of the lessons that I hope all of us take out of this hearing today is that we have two people from the private sector who know that they would never do a process like this one was done, and yours and my legislation is really about trying to create at least a modicum of similarity in IT procurement in the Federal Government the way it is done in the private sector. And I thank the gentleman for his comments.
I thank the Chairman. So I commend to Mr. Van Rokel the statement of the boss. Mr. Chow.
So now I'm the boss?
No, well, you are too.
Yeah, oh, you mean the President?
The other boss. Yeah.
Ah, yes, his boss.
The big boss. Mr. Chow, during your interview with committee staff on November 1, you were presented with a document you had not seen before, and it was entitled Authority to Operate, signed by your boss on September 3rd, 2013. Is that correct?
Correct.
The Republican staffers told you during that interview that this document indicated there were two open high-risk findings in the federally facilitated marketplace launched October 1. Is that correct?
Correct.
This surprised you at the time.
Can I just qualify that a bit? It was dated September 3rd, and it was referring to two parts of the system that were already.
You're jumping ahead of me. We're going to get there. So when you were asked questions about that document, you told the staffers you needed to check with officials at CMS who oversee security testing to understand the context. Is that correct?
Correct.
The staffers continued to ask you questions nonetheless, and then they, or somebody, leaked parts of your transcript to CBS Evening News. Is that correct?
Seems that way.
Since that interview, have you had a chance to follow up on your suggestion to check with CMS officials on the context?
I've had some discussions about the nature of the high findings that were in the document.
And this document, it turns out, discusses only the risks associated with 2 modules, one for dental plans and one for the qualified health plans. Is that correct?
Yes.
And neither of those modules is active right now. Is that correct?
That's correct.
So the September 3rd document did, in fact, not apply to the entire federally facilitated marketplace, despite the assertions of the leak to CBS notwithstanding. Is that correct?
That's correct.
And these modules allow insurance companies to submit their dental or health plan information to the marketplace. Is that correct?
Correct.
That means those modules do not contain or transmit any personally identified information on individual consumers. Is that correct?
Correct.
So, to be clear, these modules don't transmit any specific user information. Is that correct?
Correct.
So when CBS Evening News ran its report based on a leak, presumably from the majority staff, but we don't know, of a partial transcript, excerpts from a partial transcript, they said that security issues raised in the document, and I quote, could lead to identity theft among buying insurance. That cannot be true based on what we just established in our back and forth. Is that correct?
That's correct. I think there was some rearrangement of the words that I used during the testimony and how it was portrayed.
So to just summarize, correct me if I'm wrong, the document leaked to CBS Evening News did in fact not relate to parts of the website that were active on October 1. They did not relate to any part of the system that handles personal consumer information, and there in fact was no possibility of identity theft despite the leak.
Correct.
Thank you, Mr. Chow. I yield back.
The gentleman yield?
Yes, yes,
Your
Mr. Chairman.
26 seconds. Have you read the November 6th letter from the ranking member to me?
Yes, in fact, I think I co-signed that letter.
Oh, that's good. So the gentleman's well aware that even today there are significant security leaks that the ranking member was concerned, if discovered, would allow hackers to take people's private information, that there's a security risk, and I was cautioned by you not to let that out. Susanna will give you the answer if you'll just let her. Okay, I hear none.
I'm sorry, I'm not following the question, Mr.
Well, I was trying to let the staff speak to you, but the bottom line is that there are security risks today, according to you and the ranking member, that this website still has vulnerabilities, if discovered, that would lead to personal information coming out. Is that correct? In your letter?
That, Mr. Chairman, that may be. But I'm talking about a deliberate leak that frankly distorted reality based on 2 modules that were inactive, and using that misinformation to suggest that it applied to, in fact, the active website.
But end-to-end security problems in your letter do apply to the active website, right?
Well, they may, Mr. Chairman, but right now my questioning to Mr. Chow had to do—
No, I understand you're rehabilitating Mr. Chow.
No, I'm not. No,
But
Mr.
the question is, can you—
Mr. Chairman, let's be fair. I'm trying to get the facts on the record and correct a deliberate smear against Mr. Chow, not to rehabilitate him, but to in fact get the truth out, because someone deliberately leaked something and distorted it, Mr. Chairman, in the name of this committee.
No, I appreciate your concern. My concern,
I'm
though,
glad
is
you do, Mr. Chairman.
Mr. Chow had the MITRE report, and that report that even redacted you didn't want released because it shows a roadmap to the vulnerabilities of the site as it is today.
Mr. Chairman,
that's your letter.
Mr. Chairman, I began my questioning by acknowledging our joint bipartisan effort to, in fact, try to legislate reforms in IT acquisition. That is an acknowledgment on my part, and yours, that, in fact, the Federal IT acquisition process is broken. whether it's this example or some other. So I have no desire, no motivation to hide anything. But I am concerned at a pattern of calling people to give us testimony and cherry-picking their testimony to make a political point that, frankly, it does not serve this committee well in terms of its oversight role and does damage to good public servants' reputation.
And I appreciate the gentleman
I thank the Chair and
bipartisan efforts. Mr. Jordan is recognized.
I thank the Chairman. Mr. Chow, a week ago, the President was interviewed last Thursday and was asked about Secretary Sebelius, and he said the President defended his health secretary. I'm quoting from the Jonathan Karl interview, or excuse me, Chuck Todd interview, and defended his health secretary, argued that the website bugs aren't necessarily her fault. Quote, Kathleen Sebelius doesn't write code. She wasn't our IT person. Who is the IT person? Who's the person in charge? Who's the person responsible? Who's the one who signed off on this before it went public?
The person that's responsible is our Administrator, Marilyn Taubner.
And did she base her decisions on the memo you sent her on the 27th? Is that right? Isn't that the authority to operate memo?
I think that's...
I mean, the President talked about IT person. Ms. Taubner's not an IT person. Who's the IT person? Is that Mr. Van Rokel?
I
Is
don't
it
know.
Mr. Park? Is it Mr. Childs? Which of you is that person?
I don't know. I didn't speak to the President.
No, but he refers to a person. Who would it be? Who's the IT person in charge?
I don't know what the President was referring to.
Let me start with this slide C3, if I could. And this is the report that came, the final CMS final report came out October 13th, after October 1st. Just want to read the first. MITRE was unable to adequately test the confidentiality and integrity of the exchange system in full. Lower down, complete end-to-end testing of the application never occurred. Doesn't that raise concerns? Did you know about this before October 1st, Mr. Chow?
I think that's taken out of context.
It's pretty plain language. Didn't test it, no end-to-end testing, done before October 1st, and yet the IT person in charge, whoever the President's referring to, somebody said it's okay to start this thing.
I say it's taken out of context because there's still quite a few...
Mr. Van Rokel, did you know that did you know the results of the MITRE testing before October 1st?
I haven't seen this document, so I'd love to.
Well, you got the fancy title. You're the Chief Information Officer of the United States of America. That's a pretty big title, and you didn't know about this before the biggest domestic policy program website in the history of this country ever is launched, and you didn't know about this?
Sir, I haven't seen this document.
Well, that scares us. Mr. Park, you're supposed to be the guy who's going to solve everything. You're Clark Kent coming out of the phone booth here. Did you know about this before October 1st?
I did not.
And why is it?
Would you like me to explain why?
I would like someone to tell me why you didn't know that end-to-end testing wasn't done.
It's not about not knowing. It's that, for example, the first payment to the insurance companies, the issuers, are not going to occur until sometime in the first part of January. We are still building the system.
We just had this. The system all works together. It wasn't tested all at once.
We are still building parts of the system to calculate payment, to collect the enrollment data from all the marketplaces, and to make that payment.
So there's more system to be built, so we can expect more problems in the future to add to the problems we've already seen.
Security testing is ongoing.
Let me ask you this. This to me seems to be the billion-dollar question, or trillion, whatever. Why didn't you delay this? You guys knew there were going to be problems. You hadn't done end-to-end testing. Some of your testimony talks, we hoped that the test would work when we presented it to the White House. Why didn't you delay this? Mr. Chow, why wasn't it delayed?
That's not my decision to make.
This to me is the thing. You know, the chief technology people don't know, but October 1st is October 1st a date that's in the law? It's not. It's just a date. Let me cite you this here. The Washington Post article, and I know I only got a minute, but the Washington Post article I think is important. David Cutler sent a memo to the White House, says, you know what, don't keep the political people in the White House, Nancy Ann DeParle, Jean Lambro in charge. Bring in outside people. Larry Summers agreed with that assessment. Peter Orszag agreed with that assessment. But the President says, no, we're going to keep Nancy Ann DeParle in charge of this. Kept the political people in charge. And in your testimony, to the committee, Mr. Chow, you said this. When asked about October 1st, my marching orders were, get the system up by October 1st, right?
Correct.
Why? If you got all these problems, why not wait?
I didn't ask why. I said that was my mark.
And what I'm suggesting is the folks at the White House knew this thing had problems, evidenced by the testing that wasn't done end to end. They, for political reasons, had picked this date, and so for political reasons, they had to adhere to this date, and the end result is Americans' personal information is put at risk.
I tried to correct your perception of what this expert is from. It's about a long chain of systems that need to be built, and this is a point in time.
Mr. Chairman, my time is, I got 2 seconds. Let me just finish with this. We have asked, you and I have asked, Ms. DeParle, Ms. Lambro to come in front of this committee next week, and the letter we got back yesterday was they're not going to come. And they're the people we need because they're the political people in charge. They're the ones who determined October 1st was the date that needed to move forward on, and they're the ones who I think ultimately are responsible for putting at risk Americans' personal information. With that, I yield back.
Okay. Mr. Powner, there were all these questions, and you seem to have an answer you wanted to give on this end-to-end testing before it was done. Do you want to weigh in at this point?
Well, I would just reiterate the point that the security testing was done early on an incomplete system, and the fundamental question is, what is being done now and how adequate is that to date?
Thank you. Mr. Davis.
Thank you. Thank you very much, Mr. Chairman. Mr. Chairman, there has been a lot of information over the past several weeks regarding the security of HealthCare.gov and whether consumers who use this system are at risk. I'd like to hear from the witnesses about this matter and separate fact from fiction. Mr. Chow, the Federal Information Security Management Act, known as FISMA, requires agencies to protect information systems. FISMA specifically requires an authorizing official to sign off before an agency begins operating a system. In the case of HealthCare.gov, we have a memo that was signed by Administrator Taverner on September 27, 2013, entitled, and I quote, "Federally Facilitated Marketplace," end of quote. This memo says that the security contractor, again, quote, has not been able to test all of the security controls in one complete version of the system. It also says this resulted in a, and I quote again, level of uncertainty that can be deemed as a high risk. Mr. Chow, can you explain how CMS tested various components of the system for security risks?
In general, in most large IT projects that require several what we call environments that are used to move from a developer's machine in writing code and to test that locally and then to put it into a larger environment to test with other code, and you go through this stepwise process of constructing the system. I think what the statement reflects is that in any situation similar to the marketplace systems, security people have to test when they can and when they have a window. As I mentioned, there is a compressed timeline, and that compressed timeline affords some ability for security testing to occur as the software is being developed through its life cycle. I think that what the memo was just trying to say, and it was erring on the side of caution, that as software is continuously being developed, it was tested in 3 cycles. So by the end of 3 cycles, it had fully tested the necessary functions to go live on October 1st. There are, as I mentioned earlier, other system functions that are yet to be built and will continue to have security testing conducted. So security testing is a point in time. Risk acceptance of that security testing results is a point in time. And then in that memo, you will also see that we've applied various mitigation steps to try to offset the potential risks that was identified.
Do you know of any other IT systems in your experience that were authorized without completing full system security testing?
I think that is there's a slight art in the wording of that. I think every system the Federal Government puts into live production needs to have sufficient security testing per FSMA and OMB and NIST requirements. Whether we tested in 3 cycles, whether we tested annually or every 3 years, testing is an ongoing and ever-present, kind of part of the process. When we are testing the controls for a portion of a system that is ready for a particular delivery date, we fully test those. For a portion of the controls for a part of the system, as I mentioned earlier, in which we do not have to make payment on October 1st, that is then tested at a later date when that function is ready and needed in order to go into operation. So it's a iterative, ongoing process.
Has a security team been established?
Yes.
Has CMS been performing weekly testing?
Yes.
I have no further questions. Thank you, Mr. Chairman. I yield back.
I thank the gentleman for yielding back. We now go to the gentleman from Utah, Mr. Chaffetz.
I thank the Chairman. I thank you all for being here. Mr. Baseman, I'd like to start with you. Since the end of August, how many times have you personally met with Secretary Sebelius?
I'm not sure. Probably once or twice.
And when was the last time you met with the Secretary?
I believe that it was during the shutdown. The Secretary had regular meetings with senior leadership.
And so you met one time in October?
I believe so.
So you've met one time with the, you're the Chief Information Officer, you've met one time in October with the Secretary. My understanding is you engaged a hacker to look at HealthCare.gov, correct?
CMS asked us to help them with various
But
things. You
engaged a hacker to look at the system.
We engaged someone who's called an ethical hacker who was on my staff.
So you got an ethical hacker. When did they start their hacking?
It was during the shutdown.
So do you have any, and how long did it take him to complete his hacking exercise?
I think it's an ongoing activity, but he's actually based in Atlanta, and he spent a couple days.
And then he gave you a report. How many serious problems did he find?
I don't know if I'd call them serious. I think that there were something like 7 to 10 items on that report.
So you had 7 to 10 items of hacking, some of which you don't believe are serious, but some are obviously serious. What percentage of those have been fully rectified?
I turned those over to CMS for their review. Some actually weren't systems issues. They included things like physical security as well. So
you have no follow-up? You have no idea what percentage of those hacking incidents were rectified?
I believe CMS got back to my staff last week and said the majority of those had been remediated.
You don't know what percentage? It's not 100%.
I don't believe it's 100 yet, no.
So you shared that with CMS. Did you share that with Secretary Sebelius?
I have not.
You're the Chief Information Officer for the Health and Human Services.
These are fairly technical items. The appropriate place to share them is with the system owner.
But it's not safe and secure, and I guess that's the fundamental concern is even after the October launch, you're the Chief Information Officer, you get a hacker who in a couple days finds probably 10 or so problems and challenges. It's that easy to get in and hack the information. That's the concern. Mr. Powner, is this ready? Is it, following up on Mr. McHenry's question, is the site, in your opinion, currently as safe and secure as an online banking site?
I would have to look and assess the security, and all that stuff that MITRE did and the authority to operate is preliminary because it was on. I mean, MITRE said that they didn't test the interfaces, that interface testing needed to occur. So all that stuff that's preliminary raised issues, but again,
would you put your information in there?
I would have to see what the security testing and assessment has been since then.
But you're
before
looking
I was
at it.
comfortable.
So
I haven't seen it yet, so we're going to look at it. But
so the answer is not yet yes. Mr. Chow, would you put all your personal information about you and your loved ones in it?
Yes. In fact, I've recommended my sister, who is unemployed right now, to actually apply.
Did she successfully register, sign up?
I haven't talked to her lately. She's been out of the country.
Interesting. And how many, you have this report then for Mr. Bateman about the hackers report?
I do not personally, but as I mentioned earlier, there are security teams in place, including permanent security staff under the Chief Information Security Officer that coordinates with Frank's.
And Mr. Chairman, this is something we obviously have to follow up on. Mr. Park, you're a very bright and talented person. The Federal Government's lucky to have somebody of your caliber engaged in this process. And it actually gives me comfort that you're looking at this and spending some time in it. But I have a fundamental question that I want to ask you. Have you ever shopped on Amazon.com?
Yes, sir.
Have you ever shopped on eBay.com?
Actually, no.
Well, we're going to have to change. We'll have to work with you on that one.
As a Californian, I'm personally offended.
Let's go back to
I'd
the
like
Amazon
My wife
experience.
has.
The Amazon experience. When you put something in your shopping cart, is that considered a sale?
No.
Thank you. I yield back.
Would the gentleman yield?
Sure.
Mr. Chow, you've been fairly defensive about things being out of context, so I'm going to ask unanimous consent that the CMS document of September 3rd, 2013, the memorandum, be placed in the record in its entirety. But before I do so, well, without objection, so ordered. But I want to make something clear. We had previously redacted information. Is there anything in that memo that you believe needs to be redacted? Because otherwise, we'll put it in its entirety, so there's no question about that.
I would have to review it.
Okay, well, it's in the record now. By close of this hearing, if there's something that needs to be redacted, I need to know, because I'll consider redacting it. Yes?
And I just wanted to make sure that there was no sensitive information in there.
Well, that's the problem is that
I'm just trying to obey the law, Mr. Chairman, and help you.
This thing's already in the record. If we choose to redact something, the question is that there are numerous things that give us sightings of lines in September 3rd that clearly this thing wasn't ready for security in September 3rd. And when our people questioned you about September 27th, and there was no end-to-end and security concerns, you want to say you were taken out of context. But both September 3rd and September 27th, what we find is there was no end-to-end testing. And any point of vulnerability is a point that could access people's private information. Isn't that true, Mr. Powner? So the absence of end-to-end testing means that anything that can reach into the database, in fact, could be a significant security risk to people's personal information and has nothing to do with whether or not a module is about shopping. Isn't that true?
That's correct.
Okay. I yield back, and at this point, I recognize the gentleman from Tennessee, Mr. Cooper, next.
Thank you, Mr. Chairman. I'm worried that the net effect of this hearing might be to exaggerate the security difficulties of the website. I serve on the Armed Services Committee, and our own Pentagon is attacked many thousands of times a day, sometimes by foreign powers. So the entire Internet could and probably should be more secure. So we've got to acknowledge some system problems for the whole Internet, and then there are other issues we can deal with. But another concern I have is the witnesses are being badgered, and I would like to offer witnesses, perhaps Mr. Bateman, perhaps Mr. Park, Mr. Chow, and others, an opportunity to respond, because I believe in fairness, and the American people do not want to see a kangaroo court here. And the way this hearing has been conducted does not encourage good private sector people to want to join the Federal Government. I personally had the privilege of hearing Mr. Park speak in Nashville, Tennessee a couple of years ago. He spoke before a hardcore private sector, pro-capitalist business audience. And they told me they had never heard a speaker who understood business better, who got it. And it was a real tribute to me that someone of your caliber was willing to work for the Federal Government, because that instilled faith in the process. Because we are the best nation on earth. We've got to act like it. We do face problems sometimes, but the American spirit is the can-do, we-can-fix-it attitude, not the blame game, not the bickering game. So if there are witnesses who would like a chance to say a few words in public, because you've been treated unfairly, in my opinion, and I would like to have this be an equal playing field.
Would the gentleman yield for just Have I cut off anyone's answer here today?
Will I be able to keep my time?
Of course.
You cut off the ranking member of this committee at the beginning of this committee hearing.
I cut him off a minute into question and answer after he'd exceeded his 5 minutes. But no witness here today has been cut off.
But, Mr. Chairman,
every witness has been allowed to complete their entire answer. I just want to understand, kangaroo courts is quite an accusation, and I hope the gentleman from Tennessee, when he uses the term kangaroo court in the future, will think better of making an accusation. No witness has been cut off. Every witness has been allowed to complete their entire answer in every case. But we went about 6 minutes before I asked Mr. Bateman to simply conclude. That's the closest thing to anything. So this is not a partisan hearing. I will not have it accused of being a partisan hearing. We have a website that the American people have seen doesn't work. We're trying to get to an understanding of why it didn't work so that it doesn't happen again. And these happen to be experts, and for the most part, we're relying on them to be the people fixing it. The gentleman is recognized.
Thank you, Mr. Chairman. This is a hearing on a broken website by a broken committee. And the air is thick with innuendo. When the Chairman discusses rehabilitating witnesses, that implies they need rehabilitating, when in some cases the witnesses have perhaps already been abused, sometimes by leaks, whether deliberate or not. So let's focus on fixing the problems, and I think Mr. Bateman was about to speak.
Thank you, Mr. Cooper. There's one thing I'd like to clarify in response to my comments to Mr. Chaffetz. We found vulnerabilities with the system, and there will always be vulnerabilities. Every system that's out there, systems that are live, systems that we trust right now, banks, online shopping sites, all have issues because they're continually making changes to their code. That introduces vulnerabilities. And it's up to us on a continual basis, as Mr. Van Rokel pointed out, all software goes through continuous improvement. So what we're doing right now is continually improving our software and on an ongoing basis identifying vulnerabilities that exist.
Is there any other witness? Mr. Chow?
What I would like to say is that if I come across as being defensive, I apologize, but I am being defensive not in terms of me. I am being defensive in terms of the truth. And I believe that that's what this committee is trying to get to. In fact, I think that's what you said in the beginning. So when I detect that there's distortions or misuse or unrevealed things about that I spend 9 hours with your staff basically being deposed, I am going to be defensive because that is not the truth. That's all I want to make clear about my defensiveness.
Any other witness like to make a point? This committee has many talents, and it has broad investigative jurisdiction. To my knowledge, and I could be wrong because my colleagues have many talents, to my knowledge, none of us could do a website on our own. We're not software engineers, or you could? The gentleman from North Carolina.
I think, unfortunately, you've got several here, including one who made a living doing it.
Well, but none of us would want to certainly be engaged in this task. Are you volunteering to work for the
None of us want to own this particular website.
Well, yeah. But it's easy to criticize. It's hard to perform. And as the gentleman, Mr. Van Rokel, pointed out, even Microsoft with Windows XP, still revising it 12 years later. Software is an iterative process. The Internet is not perfect, but it's still one of the great technological accomplishments of mankind. It is transforming the planet in a good way overall, but there are glitches, and we work on those. So when we swear witnesses, as we do, when we put them in a very uncomfortable position deliberately, in some cases when we subpoena them unilaterally, that creates tension, and it's actually going to slow the fix of the website. So I worry about that, and the Chairman and Mr. Conley have already collaborated on what sounds like an excellent bill to fix overall Federal IT. I was very impressed when Mr. Van Rokel pointed out that's an $82 billion issue. What we're talking about here today, at least from the August cost estimate, is a 0.6% of that. Why don't we focus on the larger issue and fix it? Because, as I said earlier, it's much better to light a candle than to curse the darkness.
And if the gentleman would yield, maybe we can close on a positive note. both Mr. Pauner, who has constantly talked about stress testing end-to-end, and Mr. Van Rokel, who knows very well that Microsoft never put a new operating system up that wasn't stress test end-to-end. It still had bugs. It still had vulnerabilities. But and by the way, whenever you add a new driver or a new something else, you create a potential new one that has to be tested. But stress testing end-to-end was something that this committee wanted to know at the onset. Why it hadn't been done, because it is a best practices, which GAO has very kindly made clear. There, and I believe it's already in the record, but if not, the 9 points that GAO had made in their report of best practices that were not followed. So Mr. Conley and I, Mr. Cooper, we are trying to get to where best practices will always be used. And in this case, not because of these individuals per se. They're here as experts, but this development over 3.5 years shortcutted some best practices, and it's not the first time and it won't be the last time, but it's one where, as I said in the opening statement, it's so important when the American people are focused for us to say, you can expect better from your government in the future, and I don't mean on HealthCare.gov, I mean on all of that $82 billion worth of IT, and I appreciate your comments to that end.
Mr. Chairman, let's see about getting your bill to the floor.
Boy, I'll tell you, that's something we all would like to do, so I'm going to talk to leadership.
You are in the majority party.
You know, I'll tell you what, I'll get it to the floor in the House. If you'll help me in the Senate, we'll get this done.
I have lots of influence in the Senate. Be happy to help.
Thank you. With that, we recognize the gentleman from Michigan who knows a great deal about health care websites from his state, Mr. Walberg.
Thank you, Mr. Chairman, and thank you for holding this hearing, and to the panel as well, thank you for being here. You have plenty to do. We wish you didn't have to be here today, but when I received letters on top of letters and contacts in 6 town hall meetings that I held last week, live town hall meetings, like this one from Rachel Haynes in Eaton Rapids, Michigan, where she talks about the fact of being cutting off from her insurance, her husband and 5 children, and she says this: I hated the idea of getting on the HealthCare.gov website, as I believe insurance is a private matter. I did it anyway. The website did not work, so I called a number. And she goes on to tell of talking with a person on the phone and ultimately being hung up on. That's the reason why this hearing is important. Frankly, Mr. Chairman, I believe that this whole act that was put into law under the cover of darkness with the simple votes from the other side of the aisle, who now take offense at us having hearings like this on problems and doing proper oversight, is the reason to have this hearing today, because people like Rachel Haynes and her family are concerned not only about security, but right now, that's one of the biggest concerns on a website that doesn't work for her. I want to go back to some of the concerns in the MITRE report. And I want to ask first question, Mr. Chow has already in earlier statements to questions just before me indicated when asked why he didn't push back on opening this thing up on October 1st. He didn't ask why. So I'm going to go to Mr. Bateman, because I think that's an important question. Should have been asked. Why? Why do we have to open up on October 1st? But the question I would ask here, Mr. Bateman, MITRE is responsible for conducting the security control assessment for the Federal Exchange. Is that correct?
That's my understanding.
According to MITRE, the final security assessment for the Federal Exchange occurred from late August through mid-September. Is that your understanding?
It is.
Mr. Bateman, to the best of your knowledge, did MITRE conduct a complete integrated security test of the Federal marketplace?
I can't answer that. I don't have visibility into it.
Well, I'd like a document put up that deals with this test and the outcome. If I could have this particular document. Okay. If you see there, FFM, the website, the marketplace, complete percentage, 66% complete. That's it. 66% complete. This document was obtained by the committee. We have in place. Let me ask this question, Mr. Bateman. Is it a problem that MITRE wasn't fully able to test one-third of the exchange?
I can't answer that. This project was run and managed by CMS. They're responsible for the security.
In the security control assessment dated October 11th, 2013, and of which a preliminary copy was given to CMS, on September 23rd, 2013, MITRE writes that they were unable to adequately test the confidentiality and integrity of the health insurance exchange system in full. They go on to say MITRE also writes the application at the time of testing was not functionally complete. Mr. Powner, what are the dangers of conducting a security assessment on an incomplete system?
Well, you could have vulnerabilities that go untested. Also, too, on this document, see, there's a lot of dates that don't add up. My understanding is that MITRE conducted their security assessment in August and September, and it was later September. So there's data all over the place. The bottom line to your point, though, is it wasn't done on a complete system.
MITRE has told, Mr. Powner.
Excuse me, I just want to point out that that's a CGI-provided document. That's not from CMS. Okay. You see on the bottom it says.
Yeah, I understand that. MITRE has told committee staff that, to their knowledge, there has not been a comprehensive test of the entire system. What are the dangers posed by not conducting a complete integrated security test of all the system components, Mr. Powner?
Well, in order to ensure that your data is secure and the system safe to use, you want to test on as complete a system as possible.
Well, then, based on what you know, were Americans' sensitive personal information at risk when HealthCare.gov opened on October 1st, 2013?
I don't know what happened from mid-September on. That's the only caveat I'd like to say, because there was testing done through mid-September, and I am blind to what happened in that period of time.
Well, can you ensure? Could you then ensure?
The gentleman's time has expired. If you could wrap up very quickly.
I'll wrap up. The last question. Can you ensure the American people that the website will work on November 30th?
The gentleman may answer.
Ask him, Mr. Powner.
No, that's not my responsibility.
Okay, so you can't.
Let me ask you any other.
No, the gentleman's time has expired. If anyone else wants to answer the November 30th, they may. Mr. Park, will it work on November 30th? Properly, fully?
The team set a goal of having HealthCare.gov function smoothly for the vast majority of Americans. The team has worked incredibly hard to meet that goal.
I thank the gentleman.
With secure information?
With secure information.
On November 30th. Thank you.
Okay. The gentleman from Nevada.
Thank you, Mr. Chairman, and to the ranking member and to the other committee members, to our witnesses. This is an important hearing. Our constituents are rightfully concerned about their right to be able to access affordable health care on the website HealthCare.gov. And while the rollout has been problematic, what's been more troubling is the fact that this has been turned into more of a game than it has been about how we can work together to fix the problems of the site. And my concern is one of security of personal information. I also sit on the Homeland Security Committee. We're having a hearing also this morning on this subject. And so I want to ask about the potential security risks to consumers. Mr. Choi, do you agree that protecting personal identifiable information on HealthCare.gov is important and something that can be achieved?
I think that's something that we, as CMS and as a Federal agency, comply with FSMA and OMB and NIST specifications for securing people's data, and then following HIPAA's kind of requirements for confidentiality, integrity, and availability of data.
And can you explain how CMS protects consumer information, how that is safeguarded by CMS?
Well, I think that one of the things that, that is very obvious when you come to HealthCare.gov, and if you go to, in my opening remarks, I mentioned there are two sides to it, or two legs. If you go to the Get Insured side, one of the first things that you have to do is to register to establish an account. And we've mentioned that registrations, are up to about 17,000 per hour right now. And that registration process allows you to establish what we call a Level 1 assurance account, which is based upon the National Institute of Standards and Technology. That's very similar to something like what you would establish in terms of opening up a Gmail or a Yahoo account. It's very basic information.
Okay. Please
remember.
Move on to the next question. We're very limited on our time, and I have
right. So it's basically the answer is it's about authenticating you. It's about are you who you say you are before we let you into the system. And that is one major step in ensuring that people's privacy are protected so that they only see their own data.
And is HealthCare.gov any more or less risky to consumers than other sites, including private company information in the banking world or using credit cards to purchase information over the Internet?
I can't speak for what privacy frameworks and programs apply to private sectors, but for the Federal Government, we follow the FISMA guidelines and the requirements set forth by the certain OMB directives, and we use independent security testing contractors to ensure that we comply.
Mr. Park, you've spent some time with this website. Have you been able to understand the security features that are inherent in it?
That hasn't been my particular focus on the team, no. There's a CMS security team dedicated to security matters.
Based on your review of that, do you believe the site poses any unreasonable risks to consumers?
I haven't actually, again, dived into that personally, but my understanding is that CMS is applying its information security best practices to protection of the site, and CMS has a great track record in protecting the privacy of Americans.
Mr. Van Roekel, I understand you worked on the Data Hub. Can you explain why you believe consumers should have confidence that their information is secure as it passes through the Hub?
So I didn't actually code the Hub itself, so I didn't do the day-to-day. But one thing that should be pointed out is that that cybersecurity is part of everything we do, and it's in every. You almost can't buy a keyboard in government now without having cybersecurity considerations on that. And we built a culture of assessment and mitigation that is all about assessing the level of risk. Is it low to high? And then you put into place technology to mitigate that risk, to make sure that we're protected. The standards that we abide by are the NIST standards, which are actually co-developed with the private sector. So the banking industry, financial industry, insurance industries outside of government actually use the same standards as government do, and we hold government to those standards. And often, in many cases, lead those industries in the ability to do these things. But the other aspect of this is ongoing. You hear, I'm sure, in the Homeland Security Committee a lot around the fact that we have, cybersecurity and what we do there, you have to do ongoing testing. You have to rapidly respond, and assessments are never done. You have to just stay vigilant in those spaces.
Thank you. And Mr. Chairman, I would just say that this is not about playing offense or defense. It's about us getting this job done on behalf of the American people and working together. I am rather insulted by this House Republican playbook
the gentleman's time has
that talks about Obamacare,
the gentleman from Oklahoma is recognized.
The loss of insurance and what this means. This is not working on
the
behalf
gentleman
of the
will
needs of the American
suspend.
public.
The gentleman from Oklahoma is recognized.
Thank you, Mr. Chairman. Gentlemen, thank you. This is not a day that's probably a fun day for you. You probably didn't get up and go, gosh, I can't wait for this day. I get that, and I want to say thank you to you because all of you are professionals that have given to public service. You all could make a lot more money in the private sector, and you've chosen to serve people. And we're going to have differences of opinion on direction, that kind of stuff, but I just want to say thank you to you as well for what you're doing because you have made a conscious choice in that. Let me walk through a couple of things just to be able to get some of the reality on it. About an hour and a half ago, I went on my iPad and got to HealthCare.gov, and I hit this button that says Create Account, and it doesn't go anywhere. And it just changes colors and does nothing. And so I reloaded on this, and for about an hour and a half, I've just occasionally hit that button. This is the frustration and the struggle that a lot of folks have, and that you all have the frustration with. We get that. We have the questions, though, as we walk through this process of now what happens. Mr. Park, you were asked the question earlier about the November 30th timeline. Obviously, Mr. Zients has laid that out there as the end of November when everything would be ready and available. You said it is our goal. Can you give me more specific? Are we going to hit November 30th?
Thank you for the question, and thank you for your kind words at the beginning as well. So the goal that has been laid out is for the site not to be perfect by the end of November.
Functional people can log on.
So that the vast majority of Americans will be able to use the site smoothly. That's the goal we're gunning for. We're working very hard to get there.
So here's the issue. Around 5 million people have received a cancellation letter. I have multiple constituents that have sent me copies of their letters. All of them end with, your insurance policy concludes December the 31st. If they cannot get on and log into this site by December the 15th, they will not have access to insurance January 1, and they will be uninsured. People that are currently insured will not have insurance as of January 1. So I understand the deadline is out there for March 31 and all this kind of stuff on it. Those individuals that have received it by the millions cannot get insurance, and January the 1st will be uninsured. So I get that's the goal. But the reality is racing at us. And the comment's been made on it that we're trying to fix a plane that's in the air. I fully understand the complexities of that. The challenge of it is that many of us had said, park the plane for a year. Let's get it right before we launch this thing. That's not your fault. Y'all are dealing with the realities that are on the ground on it. But that's something that we're trying to communicate on this. Mr. Chow, I do want to ask you something. The September 27th, the ATO, the authorization to operate. In some of the committee staff that you had mentioned, that was a very long day as well, to be able to visit with committee staff on it. During that conversation, there was a back and forth on this ATO coming out that Mr. James Kerr and yourself that you had edited there. It's sent to Marilyn Tavener. In that memo you wrote, due to a system of readiness issues, the security control assessment was only partially completed. This constitutes a risk that must be mitigated to support the marketplace day one operations. You were asked by staff, what are some of those risks that are out there that are kind of the unknowns on it that have to be mitigated? During that conversation, you had listed things like unauthorized access, not encrypting data, identity theft, misrouted data, personal identifiable information. Those are kind of the great unknowns of this at that point. Then, am I tracking this correctly? You remember this?
Yeah. Those are examples that I was asked to provide.
Sure. The problem is that you're trying to mitigate on things that you don't know. I understand about mitigating on risk. You mitigate on things that you know. Is that correct? So how did you, on day one, Marilyn Tavener is signing a document saying there are risks that are out there. Some of those that you listed, we're going to have to mitigate on those. Were we mitigating for every possibility on it?
I think what you do is you under a risk-based approach, you look at the probability of a particular risk occurring, and you prioritize. And for example, one of the mitigation steps was to conduct weekly security testing and to report back to the administrator on the results of that security testing.
Sure. During that testing process, did you find that some data was misrouted? Once it was launched, are insurance companies getting information that's incorrect?
There were cases in which insurance company was getting data that were not incorrectly routed to them, but incorrectly formatted within the transaction.
Okay. Do you know who briefed Marilyn Tavener on the security risks? Because obviously she had to sign off on this document. Do you know who sat down with her and briefed her, here are the security risks, here's all the things that we're trying to walk through?
It was our Chief Information Officer and Chief Information Security Officer.
Two other quick questions. Is there a way to be able to track what personal information any employees can see while they're working on this? Obviously, we had a lot of contractors involved in this. Now we've added even more contractors, trying to learn all those contractors, who they even are. Is there a way to be able to track? Because now there's personally identifiable information in the system as well. Is there something in place that tracks what people that are working on the back end of the site can see as far as personally identifiable information?
Yes, there are system logs. Like, for example, if you call the call center and the call center representative is...
But I'm talking about people working on the back end.
Gentleman's time has expired. You can finish the question.
In certain cases, yes, like if you're in a testing environment. Very few people touch a production environment. So they wouldn't even have access to that live data. So sometimes when we use testing data, you want to see the results, so you do have developers having access to that information, but it's not live people's data.
I thank the gentleman from Oklahoma. And for the record, Mr. Chow, I wanted to point out those items that you identified as particular inherent risk were identified by you prior to the September 3rd memo that was introduced. I know the gentleman from Virginia had indicated that it was after that memo, but for the record, you indicated those prior to that memo being introduced by committee.
I don't quite understand what you're trying to say there, because the question was asked what examples, and it was in the context of the September 27th memo. You're saying September 3rd, and I don't.
Yeah, you mentioned these risks because of the failure to do integrated security testing prior to that.
I don't believe I said failure. This is the
because
problem.
it was not a result of the September 3rd
This is the
memo.
problem. I don't have the transcript in front of me. I cannot confirm with you. I was not given an opportunity to make corrections if there were corrections to be made. So you can tell me what you want, but all I can say is that, to the best of my knowledge, I don't recall saying that. I need to see my transcript.
All right. The gentleman from Vermont, the distinguished gentleman from Vermont, is recognized.
Thank you, Mr. Chairman. First, I want to join Mr. Langford in thanking each of you, Mr. Powner, Mr. Chow, Mr. Bateman, Mr. Park, Mr. Van Rokel, for the incredible effort that you're putting into trying to fix a very serious problem. So thank you. Second, you don't have to be an opponent or a supporter of the health care law to acknowledge that there are significant rollout problems associated with the website. And those of us who are supporters, and I'm a very strong supporter of the health care law, are absolutely committed to providing the support you need to make this thing work. There's really 4 issues that we have that are roiling around. One is the website. What do we got to do to fix it? And it's got to be fixed. 2, or what's the impact of these cancellation notices that a lot of Americans are receiving? They thought they had health care. They were assured that they could keep the policy they had, and the problem gets compounded if the website's not working. And then third is the individual mandate that is a subtext of the debate, but that's essential to the law. But in order to make that work, the website's got to work. And the fourth is the IT purchasing. Are there some lessons that we can learn? And I tend to think that it's really important to move ahead on the ISA-Connolly legislation. So that's the context that I think we're in. You are here to help us fix the problem, and we've got to get that done. So I want to start by just asking you, Mr. Park, if you can make some comments about, you'd be repeating a little bit, but what are the specific things we can do to get this fixed? And I understand all of us would like to have a hard and firm date where everything's going to be perfect, but what we're dealing with is the real world, and we want it to be functional for the vast majority of Americans. So what are the ABC that you need to do, and hopefully not require you to sleep on the floor in the office at night?
Thank you so much for the question. The team is taking all the right steps under the leadership of Jeffrey Zients and Administrator Tavenner. So first of all, the team has implemented monitoring across the site, improved monitoring to actually understand performance of the system and where there are issues and where to focus. Secondly, with the help of that data, the team has undertaken an aggressive program of improvements to actually improve the stability and performance of the site. Through tuning, system configurations, capacity expansion, et cetera, which has resulted in, among other things, the site being more stable, system response times going down, as I mentioned, from 8 seconds to less than a second. Thirdly, the team is working on functionality bugs, so high priority issues with respect to the user interface and the user experience, and that's actually being pursued very aggressively, of course, as well. And then finally, there is a bunch of work underway to keep improving the software release process, so you can actually fix these issues faster and faster at a growing clip. And then you have QSSI having been brought in by Administrator Tavenner as the general contractor to manage this effort, and so it's all moving at increasing speed.
All right. How are we going to address the problem that Mr. Langford had getting on the website, where you hit the enter button and it didn't work for an hour and a half?
So there's been a lot of progress on that front, and many more folks can get in now than previously through both the ability for that particular component of the system to handle more volume through capacity expansion and software optimization, and also through bug fixes that have been applied. But actually, if Congressman Langford would be so kind, I'd love to follow up with you afterwards just to kind of understand your specific situation, and then we can actually use that to inform the troubleshooting and the fixing.
Well, I'd really like it if you did, because that's a fair.
If the gentleman would go for just 1 second,
Yes.
It's pretty straightforward. I just got to that page and hit the button. It changed colors and did nothing. So it's nothing more than that as far as moving into just a log on to create an account.
Got it. And had you previously tried to? I'll follow up with you afterwards.
All right, Mr. Powner, do you have some concrete suggestions about what we can do as a Congress to make it more efficient and more effective when we're making significant IT purchases on behalf of the American taxpayer?
I have a couple very specific suggestions, and I'm going to go back to my oral statement. We're down in the weeds on what needs to be done to fix it, and the program management needs to be in place. But the IT dashboard, there's 700 major IT investments. This is one of them. It was green. Given the late start, the compressed schedule, and the complexity, does anyone think it was really a green project? I don't think so. It should not have been green. There should have been flags on the dashboard and better transparency. The other thing is proactive governance. We look at the IT reform plan, things in the FTARA bill, legislation. Proactive governance is very important. It's great, and I'm pleased that Steve and Todd and everyone's involved now, but we need that governance up front on important projects, not when things go in the tank.
Right.
We need it up front. It's the same thing with when projects go in the tank, we get engaged with the contractor more. Why don't we engage with the contractor, engage with the right executives up front instead of when we have problems? I know there are a lot of projects and a lot of priorities, but we need to find a way to tackle that better.
Okay. Thank you. I yield back. Thank you, gentlemen.
I thank the gentleman from Vermont. The gentleman from Pennsylvania, Mr. Meehan, is recognized.
I thank the Chairman, and I too want to join in this sentiment that I appreciate that you are legitimately trying to work on this, and we all are. And I happen to chair the Cyber Subcommittee on Homeland in addition and have great concerns and frustrations. And I think I reflect many of the people out there that with the concept of frustration, because in many ways, when I talk to my folks at home, this isn't about a website. It's about trust. It's about this inherent trust that they have in the relationship with their doctor is now being impacted, and the very trust they have in the ability for this system not only to operate, but to operate securely. Now, I know this is sort of outside. I was stunned when I heard the question the other day that the Secretary said, yes, we can have felons that are operating as navigators. What is going to be done from this point forward to assure that no felon will be used as a navigator anywhere in the United States? Mr. Van Arkel.
That's, in the context of this system, that's sort of a health policy
Mr. Chow,
decision. It's not a tech decision.
Is there anything that can be done? Will you participate in getting something done?
I think CMS is actively performing background investigations on.
Well, that's not what the Secretary said. Look, please look into that for me. That's not my line of questioning. But I go again to this whole issue of trust. I mean, again, trust in we had Ms. Tavenner and you before our committee testifying about the readiness in July and August of this to ready to go. Now, I just look at the background of. This is the IG's report to Congress on FSMA. One of the things that Ms. Tavenner and you were talking about was compliance with FSMA, and therefore, when you look at HHS, the IGs came out the second worst score in every agency across government, HHS, a 50% compliance with FSMA. The second worst in all of government. So we're already dealing again with a question of trust. So let me just get to the heart of our engagement, because I was so frustrated I couldn't understand how an IG's report, Mr. Chow, could have suggested that there were great concerns about the ability to be ready in time to conduct the testing. And you assured me at that time that they were on schedule and you were going to meet all of the requirements for the testing, and if, you know, as did Ms. Tavener. Now, we were told before the marketplace systems were allowed to operate, they had to do, you know, comply with all of the rigorous standards. Yet at the same time that you were testifying before me, I have Washington Post story that was saying staffers were aware by late 2012 that the work of building the Federal Exchange was lagging. Employees warned at meetings late last year and in January that so many things were behind schedule there would be no time for adequate end-to-end testing of how the moving parts worked together. So how was it done then that in this short time frame, where the own employees are saying it couldn't be done, the IG said that there were tremendous concerns about the ability to do the testing, somehow, the day before our committee had you before us, there was a report sending from the Secretary that said all of our marketplace systems are allowed to operate and begin serving consumers. And I'm pleased to report that the Hub completed its independent security control assessment on August 23rd.
The Hub was tested first, and it was completed in August, as you mentioned. I think the remainder of August and into September, we concluded the third round of testing for the marketplace systems, particularly for the functions that were needed for October 1st.
Well, how could you do the testing on the system? Because, again, you reported, but you know, here's the document that came out from CGI. And at the very time, you were saying to me that the testing was, that this had been certified as complete by the certifying agency, and Tavener was here testifying that it was done. You have at the same time an internal memo from CGI saying that the FFM schedule was only 51% completed. On the same day you're telling me that the certification has been finished. How can you complete and certify when they haven't even built more than half of the system?
I don't know what document you're holding, but I'm assuming that in August, 51% is about where we were at. Remember, we still have we have other key functions such as payment, risk adjustment, reconciliation.
How do you give certifications if only 50% of the system is built?
Because you test the components, the parts of the system that go into production and that are actually interacting with the public.
Gentleman's time has expired. We recognize the gentleman from Massachusetts, Mr. Tierney.
Thank you very much. Mr. Chow, do you feel you had an adequate opportunity to answer that last question, or do you have other things you want to add?
I think I got my last word in.
Good. Thanks. So earlier this morning, at the beginning of the hearing, Chairman Issa asked you about the anonymous shopper function. You recall that?
Yes.
You said you had decided to direct CGI to disable it because of defects, and Chairman Issa challenged you and accused the White House of ordering the action for political reasons. Do you recall that?
Yes.
Okay.
Would the gentleman yield?
No. So during that phrase also, I think Chairman Issa handed you a document, and I think it's probably still with you there.
Yes.
All right. And the Chairman gave the document and said it showed that there were no defects in the system. It does say that the function is anonymous shopper. It does say that CGI said it tested successfully. But then he has blown up a box over a number of the other statements made on the right-hand side, and that box just says 9/22. This feature will be turned off for day 1, October 1. Now, I've given you a sheet there. I believe staff has given you a sheet there that is clean from those boxes and just as the original document without the Chairman's blow-ups on there obstructing any of the other materials. Do you have that document?